which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the Board of Education's August 11th regular session meeting. I don't think we have any elected officials in the audience, but thank you all for being here. The board met in executive session with representatives from the Knox County Law Department this afternoon at 4:30 p.m. Mr. Dupler, would you mind sharing information regarding executive session meetings for the public's information?
Sure, I'd be happy to. So an executive session is the law director's opportunity to have a conversation with the board. It is one of the few exceptions to the Open Meetings Act. It is not an opportunity for the board to deliberate, which did not occur, but we did have a session to discuss pending litigation and possible litigation, and that was under Smith County Education versus Andrews.
Thank you, Mr. Dupler. And just a couple of announcements for upcoming meetings. The Naming Facilities Committee is scheduled to meet on Monday, August 23rd at 9:30 a.m. in the first floor boardroom of the Andrew Johnson Building. And the Joint Education Committee is scheduled to meet on Wednesday, August 25th at 4 p.m. in the Andrew Johnson Building boardroom. Also, board members, as we begin our discussion this evening, I would like to apologize for allowing too much free exchange between board members last week. It can be challenging when this is the only conversation we have in this setting and being mediated by the chair. However, we must be respectful toward one another. So please be sure to wait until you are recognized before speaking. My goal is always to ensure that all board members are able to articulate their thoughts and ask their questions. And I'm sure with our agenda this evening that several folks will have comments and questions they have. So please make your comments brief so that everybody has an opportunity to speak. And so I would just request that you make sure that you are recognized by the chair before you speak. Thank you. Are there any requested changes to this agenda? Ms. Babb.
Yes, and I'm going to pass this out. If you would pass them that way, in this way. I would like to add a motion to the agenda to be voted on tonight. I move that the Board of Education vote to mandate masks while inside Knox County school buildings and on buses for students, staff, and visitors at the elementary and middle schools in Knox County until FDA has given the emergency authorization of the COVID vaccine to children 12 and under. Teachers that can be at least 6 feet away from students while teaching can remove their masks.
Okay. Excuse me. If I can. Excuse me. If we can just have quiet in the boardroom so that we can conduct our meeting, that would be very helpful. Thank you. Okay, I think I heard a second from Ms. Satterfield. Okay, discussion on that. Mr. McMillan, you have discussion on adding this? Okay. Do you have your light on, Mr. Watson? Thank you, Mr. Watson.
I'm not sure. I'm sorry.
Okay, Mr. McMillan, you did have your light on. Can you use your mic, please?
Pardon, I'm sorry. Thank you, Madam Chair. While we're setting the agenda, I guess this would be the appropriate place to do that. I would like to make a motion to remove 9D from the agenda, from tonight's agenda.
Okay, we have a motion to remove 9B from the agenda. We have a second. It's not 9B?
D.
Oh, I'm sorry.
9D.
I apologize. My
As a
mistake.
dog.
9D. And Ms. Bounds seconded the motion. Okay, and Ms. Henderson is calling for the question.
So, thank you, Madam Chair. I mean, as far as calling for the question, I mean, it sounds to me like, I mean, you're not done trying to set the agenda. So you've got two motions on the floor now to set the agenda. Those two motions are going to have to be voted on at this point because there's motion in a second. So the call for the question, I don't think is in order at this point, unless you get a second and you specify which one you want.
Mr. McMillan?
Thank you, Madam Chair. Mr. Duper, does, now you correct me if I'm wrong, I'm sure you will, but Ms. Babb's making an entirely new motion. The motion I made was in regard to one that's already existing. Number two, when somebody calls for the question on an item that has a motion and a second, all debate stops and you vote on that. You vote. What I'm saying is, that doesn't mean that you continue discussing anybody that has their light on. When somebody calls for the question on a motion that's on the floor, then you vote on that. Now, if it gets voted down, well, you can go wherever you want to.
On that, so you're correct. So, I mean, if Ms. Henderson is calling for the question on your motion, is that correct, Ms. Henderson? Okay, so with that specificity, yes, I mean, the board can now have a vote to call for the question first. Yes.
Okay.
Okay, so we will vote on the question, which is before the board, which is to Mr. McMillan's motion to remove item 9D from our agenda.
Yeah. Are you,
Correct.
so yes, you're voting to call for that question.
Right,
That's what
so
you're
we're not voting to remove the agenda
Correct.
item. We're voting to call for the question.
I have a procedural question, I think.
Yeah, wait a minute. I'm sorry.
Okay, Ms. Owen, do you have a question?
I'm confused about removing one. If we're voting to remove one, did we vote to add one?
We have not voted.
That's-
Never took
So,
action on mine.
so,
I mean, that was.
so Ms. Babb's motion is still on the table, as I understand it.
Right.
You were taking motions to alter the agenda, and now there's been a motion to call for the question on one particular item. That doesn't remove Ms. Babb's item. Ms. Babb's item is still on the table, but there's a call for the question on Mr. McMillan's removal.
Would
So-
Mr. McMillan's removal make it impossible to discuss Ms. Babb's item as that topic
They're
would not be
completely
on the
separate.
agenda? Because it was not noticed?
Ms. Babb's item, I mean, can be discussed because there's a motion in the second.
Thank you.
So
But not right now.
we're not, and Ms. Babb has made a motion. She's making a motion to add an agenda item. So we're not voting on her motion. We're voting on whether to add it to the agenda. So,
But
and so Mr. McMillan made a motion after the fact, so we have to deal with Mr. McMillan's motion and then go back to Ms. Babb's motion. Okay,
But-
so that is our plan.
Madam
Okay?
Chair,
Yes.
with all due respect, I believe that when the question is called for, you don't have to vote on whether you want to call for the question. When the question is called for, it's either voted up or down or whatever. Am I wrong, Mr. Duper?
Yes, I mean, Mr. McMillan, I mean, the way the board used to operate was if you called for the question, then everything would stop. But that's not traditional Roberts rules, and a couple of years ago, the board voted to adopt the more traditional Roberts rules model. So you do have to vote on calling for the question.
Okay.
Okay, so we need to go ahead and vote on calling for the question is as in regard to Mr. McMillan's motion to remove 9D. So we're voting to call for the question. Which just means shutting down discussion and voting on the motion. So
Well, but you would come back to
we're
her.
going to come back to the motion. So we've had discussion, correct? Okay, all in favor?
Aye.
Aye.
Any opposed? Motion carries. Now we will go back to Mr. McMillan's motion, which is to remove item 9D, and we had a second from Ms. Bounds. Any discussion on Mr. McMillan's motion? Okay, so now we're ready to vote for the motion. Let's do a roll call vote, Ms. Coatney.
And this is to remove item 9D from the agenda. Ms. Satterfield?
Yes.
Ms. Owen? Mr. Watson? Ms. Babb?
Yes.
Ms. Henderson? Ms. Bounds? Mr. McMillan?
Yes.
Ms. Christie? I'm sorry. Ms. Horn?
Yes,
That's 7 yes votes and 1 no vote.
motion carries. And I will note that Ms. Christie hopefully will be joining us shortly. Okay, and now we go back to Ms. Babb's motion, which was seconded by Ms. Satterfield, and this is to add an agenda item that Ms. Babb read. So this is in regard to adding this agenda item. Mr. Watson.
This is a procedural question. Thank you, Madam Chair. I know Ms. Babb just asked for something to be added. Mr. McMillan asked for something to be taken away. Are we still accepting items possibly to the agenda that would need to be seconded?
Yes.
Yes. So,
We have a motion on the floor right now.
but we didn't do that just with Mr. Nick.
Okay, go ahead. So your discussion is relative to her motion?
Well, it's similar. And
Okay.
so I want
All
to
Go ahead.
propose it not necessarily as a substitute, but I want the board to see both options. So I'm proposing to add this agenda. And I will read it. Is there enough? Yeah. Oh, sorry, Raymond. Did you need one more, Ms. Coatney? Thank you. So the item, just for those in the crowd and in the public, a motion to authorize the Director of Schools to implement layered prevention strategies regarding COVID-19 that align with the guidance from the CDC and or the Center for Disease Control and Prevention, including but not limited to contact tracing, quarantine, physical distancing, additional cleaning, and universal masking for all students, teachers, staff, and visitors. While indoors, this guidance may change in several ways as the year progresses based on community transmission rates for Knox County.
Okay, thank you. So is there any comment, questions regarding Ms. Babb's motion or relative to Mr. Watson's thoughts, which is not in the form of a motion yet? Okay. Ms. Coatney, if we can do a roll call vote on Ms. Babb's motion, please.
Ms. Satterfield?
Yes.
Ms. Owen? Mr. Watson?
Yes.
Ms. Babb?
Yes.
Ms. Henderson? Ms. Bounds? Mr. McMillan? Ms. Christie? Ms. Horn?
No.
That's 4 yes votes and 5 no votes.
Okay, 5 no votes, motion fails. And now, Mr. Watson, do you have a motion? Okay, so now do we have a motion? Do we have a motion to approve the agenda as presented, obviously with 9D already being removed? Ms. Satterfield? Ms. Satterfield?
I would like to add an agenda item. Is
Okay.
it that time now?
Mhm.
I just want to add board forum.
Okay, okay,
Can I get a second on board forum?
Second.
Thank you.
okay, we have a motion to
I have a-
add.
I'm sorry, I have a procedural question. So I was making this in the form of a motion, and Robert's rules is that there's not a second, then the chair of the board asks if there's a second.
You
and-
were making it in the form of a motion? I thought you were making it in just I did
No,
not
I'm-
realize you were
No,
making.
yes, I'm making it in the form of a motion to add to the agenda. And
And you're doing that now? Is that what you're saying?
my intent was to do it earlier. That's the way I thought I was framing it.
Okay, I was not clear on that. Okay, so we have a motion by Ms. Satterfield and a second by Ms. Babb regarding adding board forum. And then a motion by Mr. Watson, and do we have a second? So we have a second by a motion by Mr. Watson and a second by Ms. Owen. Now, do we have discussion on this motion? There are two separate motions. So we have two motions. We have one from Ms. Satterfield. Any discussion on that one? Okay. Okay, we're going to take care. We're going to go to Mr. Watson's motion since it was made most recently, and then we'll go back to Ms. Satterfield's motion. So Mr. So you'd like to vote on hers first? Okay, we can deal with that one first. That's totally fine. Okay, so is there discussion on Ms. Satterfield's motion to add board forum? Any discussion on this?
I just want to be sure that all the board members understand that we are not voting on the motion themselves, but on adding them to the agenda.
Correct.
Wanna make
We're
sure
still on
there's
the
not any
agenda.
Confusion there, but we're just adding them to the agenda.
We're still on the agenda. Yes, ma'am. So is there any discussion on Ms. Satterfield's motion?
All it consists of is adding,
Board
Board
forum at the
forum,
end.
correct?
Yes.
thank you.
She's got something to say. So we want to let her do that. Okay, all in favor? Any opposed? Motion carries. So we'll add board forum to the end of this evening's agenda. Okay, and then Mr. Watson, would you like to go ahead and just officially make your motion? Do you want to read it again?
Yes, thank you, Madam Chair. I thought that's why I was reading it the first time. My apologies for not being clear. I'm asking to add a motion to authorize the Director of Schools to implement layered prevention strategies regarding COVID-19 that align with the guidance for the Center for Disease and Control and Prevention, including but not limited to contact tracing, quarantine, physical distancing, additional cleaning, and universal mask wearing for all students, teachers, staff, and visitors while indoors. This guidance may change in several ways as the year progresses based on community transmission rates for Knox County.
Okay, thank you. And I think Ms. Owen has seconded that. So we're not voting on the motion. We're voting on whether we're adding it to the agenda. Is everybody clear? Yes. Do we have any discussion? Do you have discussion? They don't have lights on. If you want to speak, just turn your light on. Yes, Mr. McMillan.
I can't vote for this for the simple reason that it deals with the CDC, and they've been all over the park.
We're just voting on adding it to the agenda, not on the motion
Well,
itself.
if you add it to the agenda,
Okay.
I'm just telling you why I'm not gonna vote for it,
Okay,
because of that.
all right. Thank you. Ms.
I
Babb?
guess I'll shut up and we'll move on. Thank you.
Thank you, Mr. McMillan. Excuse me.
I'm going to make something clear for people. If we do not put this on the agenda, then our public forum speakers will be moved to the end of our board meeting. And I just want people to understand that. That's how procedurally that would work.
Thank you, Ms. Babb. That's a great point. Ms. Owen?
Thank you, Madam Chair. I would note that if there is something that a board member would like to change semantically in the motion, that we can only do that if it's on the agenda.
Correct. Mr. Watson?
Thank you, Madam Chair. I appreciate the opportunity to always potentially add something to the agenda. I think this is a topic that the public wants discussed. I think that's why we have many people in our audience tonight. I can tell you that in the last week, since our last discussion on this issue, I've received 395 emails. And I think this is something that the public is curious about right now. So I hope that the board gives deference to the issue and that we're able to discuss it tonight.
Thank you, Mr. Watson. Any other discussion? Okay, Ms. Coatney, if we can have a roll call vote on adding this item to the agenda.
Ms. Satterfield?
Yes.
Ms. Owen? Mr. Watson? Ms. Babb?
Yes.
Ms. Henderson? Ms. Bounds? Mr. McMillan? Ms. Christie? Ms. Horn?
No.
That's 5 yes votes and 4 no votes.
Okay, so the agenda item will be added to the end of our agenda as 9F. Okay. And now, if we can, as amended, if we can have a motion to approve the agenda as amended. Okay, we have a motion by Mr. Watson. And we have a second by Ms. Owen. Questions, comments on approving the agenda as amended? Okay, all in favor? Any opposed? Motion carries. Okay, thank you, Ms. Coatney.
Item 5, consent agenda.
We have a motion by Ms. Ms. Christie. We have a second by Mr. Watson. Any discussion? All in favor? Any opposed? Motion carries.
6A, approve first reading of new Knox County Board of Education Policy C-250, accommodations for restrooms and changing facilities.
With a motion by Ms. Christie, with a second by Ms. Henderson. All in favor, or I'm sorry, any discussion? Okay, and I'll remind the public that we have discussed these board policies in policy review, and also last week, we considered them during our work session. Okay, so no questions. All in favor? Any opposed? Motion carries.
6B, approve first reading of Knox County Board of Education Policy G-280, qualifications and duties of teachers as amended.
We have a motion by Ms. Christie, a second by Ms. Owen. Any discussion or questions? All in favor? Any opposed? Motion carries.
6C, approve first reading of Knox County Board of Education Policy G-470, substitute teachers as amended.
We have a motion by Ms. Christie, a second by Ms. Babb. Discussion? All in favor? Any opposed? Motion carries.
6D, approve first reading of Knox County Board of Education Policy I-171, interscholastic athletics as amended.
We have a motion by Ms. Christie, a second by Ms. Henderson. Any discussion? All in favor? Any opposed? Motion carries.
6E, approve first reading of new Knox County Board of Education Policy J-197, student interference in the classroom.
We have a motion by Ms. Christie, a second by Ms. Henderson. Any discussion? All in favor? Any opposed? Motion carries.
6F, approve first reading of Knox County Board of Education Policy J-400, child abuse and neglect as amended.
We have a motion by Ms. Christie, a second by Ms. Henderson. Any discussion? All in favor? Any opposed? Motion carries.
7A, approve grant contract with the Tennessee Department of Human Services and receipt of grant in the amount of $127,590 for provision of a pre-employment transition services school-to-work program to benefit students with disabilities for a 12-month term starting October 1, 2021.
We have a motion by Ms. Christie, a second by Ms. Babb. Any discussion? All in favor? Any opposed? Motion carries.
7B, approve receipt of Tennessee Department of Education IDEA Partnership for Systemic Change Implementation Grant in the amount of $100,000 to improve post-secondary outcomes by providing real-life work experience and independent living skills for students with disabilities for the 2021-2022 school year.
We have a motion by Ms. Christie, a second by Mr. Watson. Any discussion? All in favor? Any opposed? Motion carries.
7C, approve receipt of Tennessee Department of Education ARP Homeless 1.0 grant in the amount of $120,000 for provision of educational assistance for homeless students for the 2021-2022 school year.
We have a motion by Ms. Christie. Was it Ms. Owen? And a second by Ms. Owen. Mr. Watson?
Thank you, Madam Chair. I'd like for the administration just to speak a little bit to these last two items, C and D, related to grants. And what are some of the ways that Knox County's schools is supporting our students who are experiencing homelessness.
Dr. Reiswick or Mr. Thomas? Dr. Reiswick?
Thank you, Madam Chair. So usually I would turn it over to Ms. Cook, who's actually out of town tonight. So I can try to give you some particulars of these.
Just in general too, Mr. Reiswick, I just think it's
Okay.
important for the public to understand that we do have students in our schools that are experiencing homelessness, and what are some of the ways that Knox County Schools is specifically trying to help support those students.
Sure. No, thank you for that. So we do for sure. And so there's a couple things we do with that. If a student is considered homeless, then, we let them stay in their last zone school that they were in. So what we know is sometimes there are different places where a student may be if they're homeless or assigned temporarily. So, we don't make them move zones. We try to keep everything as normal as possible for those students who are experiencing that. So they stay in their zone school. And then we also have different types of services. We provide social workers that are there to help support that. We help with transportation, and some of these grants pay for CAT bus passes, those sorts of things for transportation. Part of this grant is a homeless social worker liaison that works with those families to try to help them get them the services that they need as well. So we do work within the individual school to make sure they have the supports for that. Tutoring is another part that we provide out of this grant as well for students who are experiencing homelessness.
Thank you, Mr. Reiswick.
Thank you, Dr. Reiswick. Thank you, Mr. Watson. Any other questions? Okay, all in favor? Any opposed? Motion carries.
7D, approve receipt of Tennessee Department of Education McKinney-Vento subgrant in the amount of $94,000 for provision of educational assistance for homeless students for the 2021-2022 school year.
We have a motion by Ms. Christie, a second by Ms. Owen. Any discussion? All in favor? Any opposed? Motion carries.
7E, approve elementary school dental program agreement in receipt of an Elgin Children's Foundation grant up to $6,000 for student transportation costs associated with the program for the term of July 1, 2021 through June 30, 2022.
We have a motion by Ms. Satterfield, a second by Ms. Babb. Any discussion? All in favor? Any opposed? Motion carries.
7F, approve memorandum of understanding with Knox Education Foundation for receipt of grant funding in the amount of $50,000 annually for data tracking, access, and analysis, including partial funding support for a data analyst position within the Knox County Schools Research, Evaluation, and Assessment Department for the term of July 1, 2021 through June 30, 2024.
With a motion by Ms. Christie, a second by Ms. Babb. Any discussion? All in favor? Any opposed? Motion carries.
7G, approved donation of HVAC lab equipment with an estimated value of $17,783 from Train Energy Services to Knox County Schools Career and Technical Education Program to support HVAC courses at Farragut and Halls High Schools.
Second. Okay, so we have a motion by Ms. Christie and Ms. Horn seconded. Any discussion? Ms. Babb?
Yeah, I just want to say thank you for Train doing this. I mean, I think this is going to partnerships with our CTE programs and, our business partnerships that I think with what we heard about from Forward Next Generation, I just think this is a great just demonstration of the kind of partnerships that we're looking for in the future. So I really want to just call out Train and tell them how much I appreciate this.
Absolutely. I agree. Thank you, Ms. Babb. Any other comments or questions? Okay, all in favor? Any opposed? Motion carries.
8A, approved contract with Archer Air Conditioning Service Company Incorporated, J&F Mechanical Incorporated, and Lee Company for HVAC installation and repair services not to exceed $500,000 annually for the term of September 1, 2021 through August 31, 2022, which may be extended for 4 additional years.
Okay, we have a motion by Ms. Christie, a second by Ms. Satterfield. Any discussion? All in favor? Any opposed? Motion carries.
9A, approve increase to salary schedules by equivalent 4% for custodial, educational assistant, and school secretarial positions, and a $1,000 one-time hiring bonus and $1,000 retention bonus for custodial and school nutrition workers.
Okay, we have Ms. Satterfield has made a motion, Mr. Watson seconded. Any discussion? Mr. Watson?
Yes, thank you, Madam Chair. So just for the public, this actually equates to an 8% total. Is that right, Mr. Thomas?
Yes, sir, Mr. Watson, that would be correct.
And I think it's also important for the public to understand that although we're giving these categories of employees an 8% raise, which is fantastic and more than what they were getting, it's still not nearly enough. So, Mr. McPherson, can you speak to just a minute about what the general salary ranges are for those positions at this point? I know I'm hitting you with this cold, but 8% to some folks sounds like a tremendous amount of money, which again, it's good and I'm all for this, but I also want the public to understand that there's still work to be done.
I'll talk, thank you, Mr. Watson. I'll talk in really very general, very general range here, and Scott can correct me if I'm wrong, but obviously it can vary depending on the steps that one is on, but maybe a good midpoint would be $25,000, something like that. Does that sound right, Scott? Yeah.
And is that before or after the
Before.
8%?
Before, but again, it could vary. These are different employee
Sure.
types. But I think our probably educational assistants average could be a little bit lower than that even. So, right, it's both of these employee groups would average under $30,000.
Thank you.
Yes, sir.
Thank you, Mr. Watson. Any other questions? Okay, all in favor? Any opposed? Motion carries.
9B, 9C, and 9D were withdrawn. And 9E, approved framework for ESSER 3.0 application to the Tennessee Department of Education.
Okay, we have a motion by Mr. Watson. I heard a second from Mr. McMillan. Heard a couple of seconds. Any discussion? Ms. Henderson?
I just wanted to say I'm really thankful for this money, for this framework, for the staff for putting this together. I would love to see a monthly update, kind of like how the superintendent does his update. Maybe we could do an ESSER funding update each month. That way we can see what's working. We can stay on top of everything. The public knows what's going on with these dollars. And that way we can be proactive if we need to change or update anything that's going on. We have such a short time to spend this money, 3 years. And so I just want to make sure that we're implementing it in the correct ways. And I'd love to see a dedicated staff member who wakes up thinking about this, someone who's following the data, following the metrics. We don't want it to be 4 or 5 years out and our students still be behind. But I'm really excited about this money and everything that the staff has done to put these programs together.
Thank you, Ms. Henderson. Ms. Babb?
Mr. Roswick, and you might have covered this last week, but you covered so much that I might have missed it. What is the timeline if we should approve this? Where does it go from here, and when do we actually see being able to start hiring some of these positions, that kind of thing?
Thank you, Ms. Babb. So the submission date is by August the 27th, and the state has a 30-day turnaround to let us know if there are adjustments we need to make to it. We'll probably submit a little before that, just so we can get that feedback. But once they approve in those 30 days, then the money could be spent at that time. So the funds have to be exhausted by September of 2024, which means not allocated, but actually exhausted, spent down. So we're working right now on some of those things, because a lot of what we talked about last week are kind of 3-year plans. Some of those are year 2, year 3, that sort of thing. We're working on trying to build a timeline out for that. Also trying to be cognizant of what school load is. All this money hits in the spendable in a month. We can't, download that all on principals and teachers. So we're trying to be mindful of that too as we roll stuff out, but there's a lot we're excited about in it. Some of that will be held up in procurement too, because some of those things are things that we might have to put an RFP out for and go through that process, which could take multiple months. So, we've kind of told principals that here are the big ideas of what we're going to do, and we'll try to communicate those timelines better as far as what happens first and second as we get closer on the approval process.
But it sounds like it could be as early as October 1.
It could.
I mean, I realize it's going to take a while to get stuff.
We talked a lot about tutoring in there and kind of thought through that. Ms. Jackson and I had a conversation with the state department yesterday, and it looks like that our model is one that they're interested in, to be able to allow us the flexibility to be part of the TNL core, which is good for us. And we wanted to make sure it worked for us locally and that we had some flexibility. And they seem to be verbally confident. They still have to approve the plan that we could be part of that. So I think like it's something like that. We want to make sure and we told them this as well, that we hire the folks that we need and we properly train those folks. So that may be more like a spring of 2022 before we start, turning them out to schools and doing that. So it makes sense in those timelines, but we will try to put, some timelines together. And I like Ms. Henderson's suggestion of regular report outs to that. I would say, we could maybe kind of see what that looks like month to month. It may not look very exciting, but if we at least did quarterlies or something like that to give you that, I think we definitely could. Thank you.
Thank you, Dr. Riswick. Mr. Watson?
Thank you, Madam Chair. Ms. Henderson, I think brought up a great point, and you talked about somebody waking up every morning who's thinking about this. Dr. Riswick, I know there's been some conversation about needing to hire some support staff just to help manage these funds. Do we have a sense of what that load is going to be?
Thank you, Mr. Watson. So a couple of ways we've talked about that. And so I know Cheryl Martin, who's over our federal programs, we talked about that within that. She has a lot of folks who are in her department right now who do a lot of the federal processing.
Mm-hmm.
So as we've talked through the monitoring on that side, like the fiscal monitoring and the dollar monitoring, her working with Ron in finance, I think there's kind of some clerical positions that they may extend some of their hours that are part-time, maybe to full-time. But we really tried to be conscientious about not spending that money at the district level, but really pushing out to the schools where we could get that done. So she feels initially that they've got the capacity because, again, you guys know because you approve it, they handle millions and millions of dollars every year that go through it, that go out to schools through all of our titles, 1, 2, 3, and 4 that they handle. And so they feel they have the capacity. They have, an accountant on staff that, again, works with our finance side. So they feel pretty good about that right now, that they can do it with that. What Ms. Henderson alluded to about someone on the data tracking side, we would probably work with Steve Rutter and our REA team at this point. We have not at this point put dollars aside to have someone dedicated just to that over 3 years. But I know Steve Rutter wouldn't turn that down.
Yeah, I agree with Ms. Henderson that regular report outs would be good. And I think, as we have outcomes that associate with the way we're spending those dollars, that would be good to include in those report outs. And just for the public, just so you all know, if you want to see the full presentation, if you want to hear it, you can go back and watch the video of Dr. Riswick, who did an amazing job. But you can also access that presentation and that summary on our board agenda on the Knox County website. Do we know, Ms. Harrington, is there going to be anything on the Knox County website in the future that is something related to ESSER funding that either holds the final presentation or some opportunity for update to the public? I'm sure there's still a lot to be considered, but is that something that's being considered?
Yes, we're just kind of waiting to see, the action of the board this evening.
Sure. Thank you.
Thank you. Thank you, Mr. Watson. Thank you, Dr. Riswick and Ms. Harrington. Any other questions? Okay, all in favor? Any opposed? Motion carries.
Item 9F is consideration of Mr. Watson's motion to authorize the Director of Schools to implement layered prevention strategies regarding COVID-19 that align with the guidance from the Center for Disease Control and Prevention, including but not limited to contact tracing, quarantine, physical distancing, additional cleaning, and universal masking for all students, teachers, staff, and visitors while indoors. This guidance may change in several ways as the year progresses based on community transmission rates for Knox County.
And okay, we have a motion by Mr. Watson and a second by Ms. Owen. Ms. Babb, I think we have public forum.
Jennifer Mendoza. And if you'll state your name and county of residence, and you have 5 minutes to speak.
Good evening. My name is Jennifer Mendoza. I live in Knox County. I have an elementary age student. When I signed up to speak, I thought my objective tonight was to add my voice in favor of COVID precautions in our schools to encourage action on your part. After watching meetings where the COVID protocols were sunset, last week's meeting and now this one, I am discouraged. How do we talk about this if we can't even agree on the basics? But I ask that we try to understand each other. First, I want you to know that even though some do not want to talk about April anymore, April is important for us as parents because that was our deadline for choosing in-person versus virtual school. When we committed to send our second grader to school in person this fall, COVID precautions in schools appeared to be working. COVID case counts were steadily decreasing, and the school board was voting to follow the Tennessee Department of Health guidelines going forward. We were told that we could not change our minds. We decided to trust that you would follow the guidance of medical experts if the situation changed. So now my question is, with the spread of the Delta variant, case counts increasing dramatically, children under 12 unable to be vaccinated, and the Tennessee Department of Health, CDC, and American Academy of Pediatrics all recommending universal masking in schools regardless of vaccination status, because Delta is that contagious. In combination with other protections, why aren't you following their recommendations? And if we're being honest, we all know that the only way to achieve universal masking is with a mandate. By choosing not to enact mask requirements, you're taking a risk for the sake of normality. My next question is, what is the acceptable cost for you to be free from masks? Is there a point where enough kids will be sick that there will be a mask requirement? As a concerned parent, I'd like to know, where are those benchmarks? And in the sake of transparency and informed decision-making, will COVID case counts in schools be reported to us? So yes, as was mentioned in the meeting last week, many parents are confused. We are also now between a rock and a hard place without other feasible schooling options for our family. And we feel betrayed, worried, and angry. I absolutely do not mean to be disrespectful, but we have a lot of questions. Why are schools able to enforce a dress code that arguably has nothing to do with student safety, but not masks? Why has our children's health become political?
Okay, let's all respect our speakers on whatever they're speaking on.
Why is masking framed as just an individual choice when it absolutely affects other people? The risk of transmission is much lower when we all mask up. The CDC has made a cost-benefit analysis and has decided that it is worth it for children and everyone around them to wear masks in combination with other COVID protocols and precautions. The Tennessee Department of Health is echoing their recommendations. And why is there so much animosity here towards the experts? Medical guidelines change as we learn more about an evolving virus, and that is the very way science and medicine work. We are all concerned about making up the COVID learning deficit. Wearing masks and COVID protocols are better than mass absences, shutting schools down, or going virtual. Isn't our first goal to provide a safe environment so that children can learn? You could say that I'm being hyperbolic, that the mortality rate for children has been close to zero so far, and that there wasn't much COVID transmission in schools last year. But that was Alpha, and now we have Delta, unknown without any of the protections in our schools that we had against Alpha. Parents are worried, and more will become worried as case counts rise. Delta is more contagious. It is affecting more children. By numbers alone, that means more children will be hospitalized, potentially maxing out pediatric ICU capacity. Knoxville has been spared from a major surge so far, and I hope that continues. But there are surges across the South now, and hospitals are filling up. It would be horrible to need additional care for your child and not be able to access it because resources are scarce. Further, there is more to measure than just the mortality rate among children. We could see more cases of the inflammatory syndrome that occurs weeks after COVID, and we won't have data on that for months. We could see COVID long hauler kids with heart issues, brain fog, and fatigue. We don't know yet the true long-term effects of COVID. On Monday, Tennessee Governor Bill Lee spoke about how the local school board had the authority to enact mask protocols, including masks. Other counties here have done that. UT has already done that for university students that can already be vaccinated. Why are we not giving that same protection to the children in our district, especially children who cannot get that vaccine themselves? Our children need universal masking. I'm pleading with you to enact COVID health protocols again. Thank you for your time and consideration.
Thank you. Okay, I should have. Okay. We're going to be here a long time tonight if we can't move through our speakers. And I think we all want to hear every single one of our speakers that's come here to speak. And I should have said this before we started public forum. We have different people coming with different views. And please, as an audience, be very respectful for each of the members and let them get through their 5 minutes or however long they're speaking. Thank you. Heather Carroll. And please state your name and county of residence, and you have 5 minutes to speak.
I have a trusty assistant.
Is this okay? Or do you want us to just set it?
Heather Carroll, Knox County. Oh. I'm here again today to say that I support that masks remain optional and let's keep it a parental choice. With all due respect to this board, you and I do not co-parent together. I alone with my husband, we decide what is best for our children. You cannot tell me that you are more concerned with the safety of my child than I am. In speaking tonight, I want to keep the main thing, and that is that mask mandates are pointless as masks do not prevent the spread and the contraction of COVID-19. While I truly believe, like the lady that just spoke before me, there are well-meaning yet misinformed parents trying to do the best for their children. Trust me, COVID is not the issue I thought I was ever going to take on, yet here I am. I will always stand in the gap for my children and stand for what is true. And what is true is that our kids deserve to be kids. Our kids deserve to go to school and see their teacher's facial expressions, to learn and to laugh and to communicate with their peers without the barrier of a mask. As I stated last week, masks are actually more harmful to our children, and they do not stop the spread of COVID. There is study after study. Doctors across all specialties have proven and concluded that masks do not prevent you from contracting COVID. Teaching institutions such as Johns Hopkins, Stanford, Harvard, even the CDC have said masks potentially have the probability, or potentially could stop COVID, but potentially means possible, but there's no scientific data. What is proven, like I stated last week, is that the size of a COVID particle can infiltrate the cloth mask that our kids would wear to school. They do not prevent us and our children from getting COVID. In a recent article on the effectiveness of masks, it states the CDC admitting in a recent report said that mask mandates merely, as I just said, have the potential, but not the science to slow the spread of COVID. You can check this on the CDC website, which is interesting because the definition of potential literally means existing impossibility. We have to ask ourselves, are we following facts or are we being motivated by fear? When we're listening to the narrative from the news medias, on our social media, it is fear. It is, you hear statements and headlines like the Knoxville cases have risen 200%. But as I've listed out on these poster boards in front of me, even though our active cases have risen since last week, it has not changed hospitalizations. It has not increased deaths. An active case, as defined by the World Health Organization, states a probable, suspect, or confirmed case of COVID. It does not mean hospitalizations, and it does not mean a death sentence. Our children deserve to go to school without a face covering on their face. And as their parent, I know what is best for them. With all due respect, you do not. And to put a mask mandate in place is not okay with me and a lot of other parents. We should be encouraged by the facts of COVID. We should be encouraged that even though cases rise, the death mortality rate stays low, which means you have a very high percentage of recovery from this disease. And as I stated last week, if you are not a high risk or do not have a high risk medical condition as a child, then you almost have a 0 chance of dying from COVID. There are 650 pediatric auto accident deaths every year. You have more of a risk of your child dying in your car driving them to and from school than you do from them contracting COVID and dying. But what we're not talking about is the anxiety and the fear and the learning loss and the behavioral issues that have popped up from wearing these masks. It is time to put this to bed. I would implore this board to truly look at the facts and not listen to the anecdotal cases, but to the facts. I do not discount anyone's real fear or what they may have experienced personally with COVID, but it is time to put this to an end so you as the board can get back to matters that truly means something to the school board, like our curriculum and educating our young people. I implore you once again, keep masks optional. Here's another thing. If you mandate it, you take away my choice to decide what is best for my child. Keeping masks optional allows those that want to mask their children to still make that choice. We live in a country where we should have body autonomy and free choice. And not to mention that the science proves masks do not work. Thank you.
Thank you. Mabry Shields. Mabry Shields. Oh, sorry. Sorry about that. Mabry, if you'd state your name and what county you live in, and you will have 5 minutes to speak. You can start now.
My name is Mabry Grace Shields, Knox County. I'm a 6th grader at Halls Middle School. I want to speak with you about masks. Last week, the board held firm on no mask mandates this year. This is a constantly changing area, and I want you to hear from one of the children that this directly affects. Last year, we complied with the mandates. There were schools all over the country that did not have mask mandates, and their cases were no different than where kids were masked. This year, we know more, and we know that kids are not at risk from COVID. If we get it, we bounce back, just like kids have done for centuries. As of July 19th, 2021, 335 minors nationwide have died of COVID-19 in almost 18 months. And the CDC is recalling tests that are not accurate. And the CDC also notes that 35% of those could have had nothing to do with COVID. In addition, every minor who has died has had a significant underlying of medical conditions such as leukemia. These were sick kids. Not one single healthy kid has been identified as dying from COVID-19. Contrast this with approximately 450 minor deaths from flu in any given year, which, by the way, is 12 months compared to 18th month COVID data. So what does this mean to me? It means that this is highly unlikely that COVID-19 in any form is going to be the cause of my death. So 335 deaths in 18 months. Looking at CDC numbers from 2016, did you know that 995 minors died from drowning? So maybe we should ban swimming. But no, that won't work because a child can drown in 2 inches of water in a bucket. So maybe we ban water. That doesn't make any sense, does it? 4,074 minors die in vehicle accidents. So maybe we don't let anyone drive anymore. This is about how much sense masks make. The only way to completely protect us is to not breathe. There are all sorts of stuff in the air that can make us sick. But with hygiene and good health, my body fights most of it off without me even knowing it. I'm not afraid of COVID. If I get sick, I'll get treatment if I need it and take care of myself and get well. If I was afraid of dying from COVID, then I should be terrified of swimming or riding in a car. Those are way more dangerous to me. Did you know in 2016 there were 2,335 suicides by minors? The risk of children committing suicide during normal conditions is nearly 10 times higher than the risk of death from COVID. It is widely known that kids have been through a lot mentally from masks, isolation, and lockdowns, and suicides by kids went up during this pandemic. One of my brother's friends committed suicide last year after being stuck at home for 6 months. It is very real. I do not understand why grown-ups seem to be so determined to scare us, to make us afraid, to isolate us. Teach things like good hygiene, proper etiquette, like coughing into your elbow, and generally how to be clean and healthy. I traveled all over the country this past year. When I came back from Mexico, we had to pay to have a COVID test and have papers to come back to my country. But the border is open and hundreds of thousands of people are coming with no papers and no tests. And they aren't coming home. They're coming illegally. But no one is concerned if they are sick or carrying COVID. But yet people want to mask school children? If at 11 years old, I can see that this doesn't make sense, then I really can't understand how so many grown-ups don't. If you want to continue to ignore the nonsense, that is your choice. But please stop trying to scare us. We want to live our lives fully and with joy, and friends and family, to not be miserable in a hot, wet, smelly mask. Personally, one of my greatest attributes is my smile. And last year, you made me lose a huge part of myself when you took my ability to share my smile with others. Please stop playing politics and fear-mongering with our lives. Wear a mask if you choose, but don't make us if we don't want to. Thank you for your time, and please continue to stick up for us. Thank you.
Thank you. Amber Richards. Amber Richards. And state your name and county of residence.
Just a little bit taller than her. My name is Amber Richards. I live in Knox County. Anthropologist Margaret Mead was once asked by a student what she considered to be the first sign of civilization in a culture. The student expected Mead to talk about clay pots, tools for hunting, grinding stones, or religious artifacts. But Mead said the first evidence of civilization was a 15,000 years old fractured femur found in an archaeological site. She explained that because it takes 6 weeks of rest to heal a fractured femur in societies without the benefits of modern medicine, this was evidence that another person had taken time to stay with the fallen, had bound up the wound, had carried the person to safety, and had tended to them through recovery. A healed femur indicates that someone has helped a fellow human, rather than abandoning them to save their own life. So I start here. We have come very, very far in our modern capabilities, but as we've advanced, I feel our compassion, our empathy, our kindness is dwindling. Our willingness to protect the young, the innocent, the helpless, the sick and afflicted, and even ourselves in society has clearly become unimportant. And where that dwindles in society, society begins to crumble. As a parent, I have a responsibility to my children. My responsibility to keep them safe is why I'm here tonight. My responsibility to my community is why I'm here tonight. And while I hope to become more and more involved in other matters regarding school business, I believe our children's health and safety at this time in this year is where we should be focusing when there's concern about that possibly being threatened. My daughter has learned the following in school. We take care of ourselves, we take care of others, and we take care of our school. As individuals, we are responsible for our own actions. As we share this beautiful earth with others, we have a responsibility to them to be civil, to be kind, and have difficult conversations when it is necessary. And as a county school board, you have the responsibility to take care of the school and the current health environment. You may not have anticipated the situation when you ran for a seat on this board. If you did anticipate that, I'd be really surprised. But I ask you now, as parents, we are doing our part to ensure our children's safety. Will you, as board members of the Knox County School Board, accept your responsibility to face what the experts have said and what our children deserve and create a mandate for masks until this pandemic subsides, or better yet, is gone? And I might add that the CDC, in science, you never list 100%, because that never happens. There is a reason for that wording, and that is because of the probability of the chance that something might happen and that might not work. But the science is clear on this matter, and masks do work. If we don't take on the responsibility to protect our children, then that places the responsibility squarely on their shoulders. When in the history of the world has anything like this been left up to children? Children do best in a structured environment with boundaries. There is confusion for them when it is a free-for-all, and the stress increases. It is not a structured environment. There is confusion in what the rules are, and it is not unifying. This is an opportunity to back up what we hope they will eventually learn, that separating truth from misinformation is vital. And taking care of others means we progress further than we could if we only take care of ourselves. It is an opportunity to display to this country that this is a district that believes in education, that we believe in thinking critically. It's an opportunity to look bullies in the eye and speak up about what is going on. Children are resilient, that is scientifically proven. That resilience comes from factors in the child, the family, and the community, and through routines in the community, like school and religion. The mental trade-off of wearing masks to school compared to virtual schools at home alone is significant. They do better in person. These cloth coverings are a tool
to normalize life for the vast majority of people, whatever their circumstance. It is the kind thing to do because we are not doing it just for ourselves. We are doing it for everyone. We need to show that we take care of others. I speak for all of us when I say that we're tired of this. We don't want to be doing this anymore, and it's possible that we wouldn't have to. But the hard thing, the right thing, is to utilize this authority that this board has to make decisions about masks and other mitigation efforts. It is time to accept your responsibility and help our children. Helping someone else through difficulty is where civilization starts, Margaret Mead said, the archaeologist I referred to earlier. Never doubt that a small group of thoughtful, committed citizens can change the world.
I'm going to have to stop you, but thank you for coming.
Thank you.
Vera Dygert. And please state your name and county of residence, and you'll have 5 minutes.
Good evening. My name is Vera. I'm a resident of Knox County. I have a son who attends public elementary school here in Knoxville. I'm here to ask you to reconsider the mask policy and institute a mask requirement for students and staff that is consistent with recommendations of not only the CDC, but also the American Academy of Pediatrics, the Tennessee Department of Health, and the Knox County Health Department. The current recommendation is that schools implement universal mask requirements in order to support in-person learning while keeping kids and staff safe. The concern here is not just about safety, but the right of my child and all the children in this school district to continue attending school in person without interruptions. Without a mask mandate, it's likely that schools will experience large preventable outbreaks. Does the board have a plan for what will happen if schools experience outbreaks or a large percentage of teachers or staff are out sick? Will we need to shut down the schools? And will parents be forced to leave work to watch their kids because their schools are not able to stay open because they don't have sufficient staffing or because their kids are sick? Keeping kids in school is critical for the mental health of both the kids and the parents, and in-person learning is supported by the American Academy of Pediatrics. The AAP strongly advocates that all policy considerations for school plans should start with the goal of keeping students safe and physically present in schools due to the negative mental health impacts of remote learning. The board's current policy of not requiring masks undermines the goal of keeping schools fully open and staffed and is inconsistent with every medical recommendation that I am aware of, including my own children's pediatrician's recommendations. The message that your current policy sends is that this board does not care about in-person learning. The message that this sends is that the board does not care about students' mental and physical well-being. And sadly, the message that this sends is that the board hasn't thought through the short and long-term implications. When I called my school to ask what preventative measures they are taking to prevent the spread of COVID, they said that they are asking students to wash their hands. How will washing hands prevent the spread of an airborne virus? It's nonsense. Masking is a reasonable ask of our community so that kids can continue schooling in person and parents can protect their livelihoods and not have to leave work to watch their kids because schools can't stay open. We already require kids to be vaccinated to attend school. We ask that they wash their hands at school. We require that they come to school wearing clothes and shoes. Why is a mask any different? On Monday, Governor Lee said that the way that the laws are set up in Tennessee, school districts have the authority to institute mask requirements. The governor is telling you that you have the legal authority to do this. And so I ask the board to act consistent with the current medical recommendations and implement a universal mask requirement to ensure that our kids can continue learning in person and without interruptions. Thank you.
Thank you. Kaliana Godsey. Is she wanting to speak? Yeah. Hold on, let me check.
want to do it here?
Okay, Kayleana, can you tell us your name?
Callie.
Okay, okay. Would you like to speak to us now?
Where do you live? Where do you live? Knox County. She lives in Knox County.
Okay.
Go ahead. Just look at Miss Betsy and Miss Patty. You know them. Go ahead. Okay, go. I'll talk after you. Go ahead.
No,
Okay, I think you don't want to do it? Okay, she doesn't want to do it.
That's fine.
There's a lot of people here.
No, I understand. Hillary
No, I hate-
Godsey.
That works. I'm Hillary Godsey, and I'm from Knox County. I'll just say what she wanted to say because she was practicing it, but she wanted to thank everybody for taking off the mask. She had a great first 3 days of school, and she loved seeing her friends. So that was all that she was going to say. As for me, I wanted to say, if you call the health department right now, they have no test for the Delta variant. So there's not any real numbers coming from that. When we're talking about the CDC, they keep saying recommendation. And if we look at the definition of recommendation, it's to suggest an act or course of action. The definition of suggest is to offer for consideration. The CDC also suggests that you don't eat raw fish. And I know a lot of people that eat sushi. It also says not to eat raw cookie dough. I eat raw cookie dough. That is something that you are taking in as a recommendation, but you're making a decision. And as one of the speakers said earlier, we're not trying to take away everyone's ability to wear a mask. I think if you want to wear a mask, that you should wear a mask. If you feel that it's safe for your children and that's what's best for your children, then put a mask on them. I want you to do what's best for them. You know them better than I do. You know them better than any of the board members do. But what's being asked of tonight is that we put masks on every single kid. My child was sick last year from headaches and stomach aches, and it was directed back at the masks. So this year, she will not be wearing a mask. Even if it's put forward that you guys want to do that, I will have a doctor's note because my child gets sick from masks. Your child may get sick without a mask. Put it on them. But I think we're crossing a really dark line if we mandate it and make everybody do that. I'm not sure, but I don't think any of you are my daughter's pediatrician. And I consult with my pediatrician because my pediatrician knows my child and I know my child. What it also, I think, comes down to, we keep talking about the masks and we talk about COVID, but I think we have a bigger problem here when it comes to communication. And between the district office and the board members and the principals and the parents, the communication is absolutely horrible. And I think we need to focus more on that than on if we're masking or not masking. And the superintendent had said in the summer that we would be going back to normal. So as parents, we see that as, okay, we're going to be allowed back in the school. We're going to be able to not have masks on. We're not going to have any of the temperature checks. But there's a lot of schools right now, they don't have lockers. I'm not allowed to go in my daughter's school for lunch anymore because they're still distancing the kids. And it's in regards to behavior, they're saying, but I don't trust that. There's other schools that are doing it and saying behavior. What do I know to trust? Because it's been said this whole time that that's why we're doing it. In PE, she just told me this morning that yesterday in PE, they distanced 3 feet because that way they wouldn't get sick. So are we back to normal or are we not back to normal? The principals can make their own decisions, and I love my principal. I love my school. I love my faculty. But I'm just really confused as to who is in charge of certain things. And I think that needs to be more at the top of the priority. And I think if that gets worked out, a lot of this other stuff would get worked out too. I appreciate your time. Thank you.
Thank you, Matt Blackman. If you'll state your name and county of residence, and you'll have 5 minutes to speak.
Good evening. I'm Matt Blackman from Knox County. I would echo the board. I would request no cheers. I'm unlikely to get them. And please, no booze. I am a fragile daffodil with a gentle ego. That's supposed to be funny. See, I don't know, man. I don't know how y'all do it. My name is Matt Blackman, and I'm a proud resident of Knox County. I was born in Maryville at Blunt Memorial Hospital. I'm also a proud parent. My daughter just moved to college. Please don't ask me about that. I will cry. After graduating from Bearden as one of the only students in Knox County to make a perfect 36 on the ACT. My son is an 8th grader at West Valley. all honors. I know a little bit about kids. I also know a little bit about community involvement. I've served locally as a baseball coach and a commissioner in a local little league. I've served on the board of local PTSAs, PTOs, PTSOs, and other acronyms. And I'm also currently on the board of directors of one of our local education foundations that returns tens of thousands of dollars per year in support of our local schools. I know a little bit about community service. I've also been a past substitute teacher. I've taught as a professor full and part-time for 30 years, from the community college level all the way to Penn State. So I know about education. My job is not to talk about what other people say are the statistics. My job is I am a healthcare informaticist, which nobody knows what that means, not even me. What that means is I deal with data. All the bits and numbers and parts and pieces and statistics that we all throw at each other, that's my job. It explains why I don't get invited to a lot of parties, I suppose. That's another funny thing, they're a tough crowd. I have been working COVID response since January 2020. Yes, since January 2020. Because as a data scientist, I saw the national statistics and trends in data. Now, I say all that drivel to give you a background on why I come to bother you today. Tonight, I come to echo the warning of the professionals in this field, people who actually deal with the data. The doctors, the data scientists, the physicians, the physical therapists like my wife, who is now dealing with post-COVID patients again. The data released just today in Knox County shows that Delta is spreading at an uncontrolled rate. Let me repeat that again. It's spreading at an uncontrolled rate. It doesn't care what I think about it. It doesn't care what I feel about it. It doesn't care how it makes me respond. The data is the data. We also learned today that in our 19 hospital region, we have less than 5 ICU beds left available, maybe even fewer. I didn't check before I walked in. Why does that matter? Well, if I get into a car accident on the way home, or if I have a heart attack or other major health issue, that means I may not be able to get care I need. If my father falls and breaks his hip, he may have to wait in the ER a long enough time to set up infection before he gets care. If any of my children get sick, they may have to wait for a critical care bed. Uncontrolled spread is a compelling threat to us being able to finish in-school education this year. We cannot go back to virtual. We cannot go back to distance. You are committed to finishing in person. Me too. It is critical to do so. ABC Science Collaborative just yesterday released the largest study on masking to date. They looked at 1 million real students. The data is clear. Masking is the most effective way for in-person education to happen. Their conclusion matched the universal opinion of scientists and healthcare professionals. I will read. Masking, then, is one of the best, most readily available methods to protect children from any disease, universal masking being the most effective. We've talked a lot about death rate. Lots of children don't die from COVID. Statistics tell us Delta will claim 1 child this year without masking. It's not a prediction, it's a data estimate. What about long-term impacts from COVID? Children may not die, but they may well have lifelong disabilities from this illness. They may have MICS, they may have other issues. If you're serious about in-person schooling, allow Superintendent Thomas to effect it. Thank you for your attention.
Thank you. Stephen Rogers. Please state your name and county of residence, and you have 5 minutes to speak.
Good evening, Steve Rogers, Knox County. I have buried a student. I looked at a mom while she wore a necklace that looked like this, that was on her son. I saw what that pain was like. I felt that pain when I read the eulogy. And call me crazy, But I don't want anyone else to have to do something like that. So that's why I'm saying what I'm saying. That's why I'm a little loud right now. I'm sorry. Those of you that know me know that I love a metaphor. It's going to take about a minute to set it up. Please humor me and follow this. I am an expert in contemporary percussion. I have performed, composed, and instructed modern percussion techniques on 2 continents, across language barriers, at the highest levels in academic and non-academic settings. I feel very safe in saying this, and I can easily call up 50 people right now in my very specific niche field that will attest to the same, that I am a top caliber professional resource in the field of contemporary percussion. I also have degrees that directly feed and address my expertise in this very specific niche field. A member of this school board is a part of the profession that acknowledges the aforementioned claims. I qualify as an expert in an exceptionally narrow, narrowly defined field. Beyond that, I am a highly educated person. I hold multiple degrees, considered outside of the niche field in my general professional field to also be a high quality resource of renown. I've been told this by multiple current and former members of this very board. So there's no person on the board qualified to tell me that I am ignorant of the pedagogy of percussion instruction in contemporary music field, especially in the competitive rudimental circuit. So as an example, without Googling, who here can tell me which of these is not a professional term for my field? Flam, flive, fa, flaw, cheese, chudda, parapatida, or Irish sevens. And yes, some of those are real, all right? But you don't know because you're not an expert at what I do, right? So I think no Instagram post, no radio pundit, no person who is anti-percussion can say that I'm not qualified for this. I think everyone here can get that. That's the setup. Now, replace me, Stephen Rogers, with an epidemiologist. Replace percussion with virology. How do we suddenly just change our minds about what is an expert? I don't understand how that happens. How could all of those points go out the window? I ask because the virulent anti-public health decisions that are being made by an unfortunate number of people disagrees in that exact manner. A field that someone is a quantifiable expert, peer-reviewed support backs it up, gives information to a recipient who, no matter the level of intelligence elsewise, just doesn't understand that specific information at the necessary level of complexity. That we have outspoken defenses against acknowledging that concept that is straight out of Instagram posts or from a radio pundit or anti-health public figures and their anti-public anything. That's embarrassing. So Asa Hutchinson, governor of Arkansas, did something recently, and I don't agree with the guy very often, but I got to give him credit on this where credit is due. He exemplified mature learning. He changed his mind when he was presented with better evidence, which is also the scientific method, a Tennessee state standard. He quite notably and publicly stated that signing the bill that removed the power from school boards to determine masking standards was a mistake, and he regrets signing it. It takes a spine, and it takes a moral conviction to admit a mistake, and I am deeply proud of him for that, all right? His cross-state tour to promote vaccination is something few other governors in his position have done or will do. Ours? I understand that the political world is messed up and that donors for person A might be donors for person B down the line if person B, toes the line for person A. I don't like that, but I know it's part of the game. It's an unfortunate necessity, and I stomach it from time to time from both opponents and allies. But I have never stomached it when the health and safety of children is on the line, and I'm not starting today. I know enough about what I know to realize I don't know enough about what I don't know. And that's when I turn to experts. For surgery on my arm, to replace my transmission, all that, I go to experts. You come to me for percussion, don't go to your barber for it. I implore you, go to the epidemiologists, the virologists, the people who devoted centuries of accumulated life's work to studying and defeating disease. That information has been brought to you by the wheelbarrow full, much to the dismay of many a Parler account. People have been coming before this board with claims that fail to meet the standards of truth or reality, and it's been given the same credence as analysis by experts. Now, some folks have brought real data, but the analysis wasn't strong, and that's a dramatic misinterpretation. So here's a very famous thing. I know I've got very little time. All right, survivorship bias. You take a plane from World War II, they trace where all the bullets hit the fuselage, and they're trying to see, okay, where do we reinforce it to protect the plane? You don't reinforce where the bullet holes are. Those planes got back. They didn't need the protection. It's the places that weren't hit with bullet holes that goes down. The guy that created operational research, Abraham Wald, came up with that, okay? That concept, we have got to be better than it.
Thank you for coming. Justin Ash. Please state your name and county of residence, and you have 5 minutes.
I am Justin Arft. I live in Knox County. I should say from the outset, I do work at the University of Tennessee, but anything I say here tonight is entirely from my perspective as a parent of 3 children in Knox County elementary schools. In the spirit of adapting to changing situations, I had something I was going to read tonight and decided to just respond to some of the other topics that are still on the agenda, but some of the motions that were brought up as well. It is heartening that we are hearing some of these motions brought to the table to enable the superintendent to enact policies based on guidance from experts. And that is really all I'm here to ask you to do tonight. There is an abundant amount of guidelines, recommendations from the CDC down to the local health department, including the state of Tennessee. It's abundantly available online. I've been in touch with some of you about this and sent you some of those links. I encourage you to look carefully at those, because back in April, and I know that we don't want to keep talking about April. I want to keep talking about April because the board voted to follow. It said we will follow guidelines from the state, and those guidelines were based heavily off of the CDC's own guidelines, and that was wise. That was a good thing to do. It was also a good thing to do to say that you would adapt to changing situations if you needed to. I can't do a justice to the numbers like the gentleman just did, and those jokes were very funny. I appreciate that. If you would see me smiling under my mask. But I do want to point out a number from June 14th, because on June 14th, I remember feeling pretty good about the situation, about the local situation. Some people know, how many at-bats Cal Ripken had in 1991. I know what the test positivity rates are on a given day this summer, right? But I was watching it because I thought, you know what, things are getting better. And I think we all felt that. I think we all anticipated that in April when the board said, hey, you know what, we're going to sunset this policy, but we're also going to keep an eye on situations. And we have guidelines that are ready made, and we're going to allow the superintendent to act on those. Again, that was wise. In June, things were feeling better. Numbers were very low. Their test positivity rate was 1.2% that day. That is kind of a managed crisis, right? Today, that is not the situation at all. And I promised I wasn't going to spout numbers here, but I do want to reinforce those numbers from today from the local health department. On July 3rd, which, I looked at the day before the holiday because we all know that holidays have an effect on these numbers, there were 8 people in ICUs in the entire East Tennessee region. Today, there are 96 with only 5 rooms left. So we cannot make the claim that the Delta variant is not having an effect on the local situation. And I think we all also know that these increases in cases, these surges tend to happen and cluster around times when there are holidays, when there are breaks, or when there are times where we're all spending a lot of time indoors with one another, maybe without precautions. We know this, right? We're 3 days into the school year. Our kids, there have got to be thousands of classrooms in Knox County schools. Our kids are now simulating that indoor hangout environment that we know causes surges thousands of times a day, 5 days a week for the unforeseeable future. We are going to contribute to a growing crisis if we don't do anything. The surge will get worse if we don't do anything. I am asking you all to act on the very good guidelines that you have at your fingertips, the tools that the state of Tennessee is offering you, the guidance that they are offering you, and come up with a full layered strategy, not just for masks. I think that we've all lost sight of some of these issues because masks are such a charged issue. What about contact tracing? What about distancing? What about testing in schools? The state of Tennessee has guidelines publicly available right now. I've been reading them for the last few days. They have a lot of guidance and tools available. And I would like to see the board act on that. And I would like for the superintendent to have the authority, which my understanding is that he does, to enact these guidelines and come up with a plan for what happens next. Thank you.
Thank you. Laura Branson.
I had not prepared to say anything tonight because I really feel like I'm sorry, Laura Branson, Knox County. Okay. Because I feel like we've all made our points both sides. We know there are some who feel one way and some who feel another. However, it's evident, it's clear now that we cannot let this rest either way, because we have to come to a point as a community where we can come back together and agree on one thing. I wanted to thank Mr. Thomas for last week especially, and to let him know that we, first of all, as parents, we appreciate the fact that you fought, it has not been forgotten, that you fought really hard just to have our students back in schools last year. And that has made all the difference. I feel it has made all the difference to put us slightly ahead of other places. So please understand that we as parents, thank you for that. We know your job is not easy. I know none of you has an easy job up there. You get emails, again, left and right, I know, because I'm one of them, all the time, whether you are for or against the masking. Today, I looked it up that on our health board's website, there are currently 39 sick children in the hospital, 39 with COVID, okay? Or so they say with COVID. There are 1.7 million children in the entire state of Tennessee. Now, I'm all for the argument that it's the one child that we can save. It's the one child that we can make a difference in their life. But if it has to apply in this instance, don't put your kid in a car tomorrow. You shouldn't have shown up tonight in a car if you're worried about one thing happening to you. I feel really sorry for the people who we've been brainwashed. We've been brainwashed our whole lives by the mainstream media. There is a narrative that people are following, and they are trying to make us afraid. There's fear-mongering going on left and right, and there are so many people who are succumbing to it. If you're afraid of your child catching COVID, if you're afraid of yourself catching COVID, I know someone brought this up earlier tonight, by golly, put a mask on your child. Don't trample on my freedom, on my ability to parent my own child. And that is what I was referring to in the beginning, that we've got to come together as a community and realize we are a country of freedoms and rights. The fact that I don't want to wear a mask, or that I don't want my child to wear a mask, has nothing to do with any of the other parents here or anybody else's ability to make their own choice. How dare you tell me it's okay for my right to be taken away, but it's okay for you to trample, but it's not okay for me to say, I want my freedoms, you don't get yours. I'm also in complete agreement with, I think we're not supposed to call out anybody on the board by name, and that's fine, but there's a particular member who, he's made a very good point that we cannot continue to follow what the CDC says, because they have gone back and forth with their opinions and their statistics. They are a paid organization. If you look at who they get paid by, it's very evident to see there's a narrative that they are trying to follow. This Delta variant that they're talking about, I've seen the list of the next variants that they're planning. They already know when they're going to affect us. I believe Lambda is the one they're going to come out with in September. There are no tests that can say it's Delta variant. There are no tests that exist for that. So we cannot sit here and say there are all these kids getting sick from COVID, from the Delta variant. I also wanted to make sure that I brought up the fact that we discussed last week, especially, that no child should be bullied whether or not they want to wear a mask. I am totally in support of that. And I know every parent in here believes that their child does not deserve to be bullied whether or not they're wearing a mask. Now I'm hearing from parents all across, from my own son at his high school, that teachers are now trying to signal out students who have been vaxxed and who have not been vaxxed. If you want a lawsuit on your hands, then don't want a lawsuit on your hands, you better make sure that these teachers are not singling out our children whether or not they've been vaxxed, because we are way beyond that kind of, I'm losing my words, segregation that we do not need to put up with. I do not want my child not getting the proper education because he's not been vaxxed or given the jab.
Thank you very much. Kim Sprague. Please state your name and county of residence, and you have 5 minutes.
My name's Kim Sprague, and my county of residence is Knox. I want to thank all of you guys for sitting here and listening to us and allowing us to share our thoughts with you. I do have an expertise. I'm a mental health therapist of over 30 years. I'm a licensed clinical social worker, but I come to you tonight as a parent of 3 teenagers, last one that's still in the school system here in Knox County. I've shared with you before about the mental health impact that COVID restrictions have had on our children. I'm sure you remember, right? I won't repeat it all. I want to add, with school back in session, the threat of reinstating restrictions is very upsetting to students. It's causing an increased sense of uncertainty, apathy, and anxiety, really, more than I anticipated. Kids feel like the other shoe is going to drop again and that they should just give up. So I ask you to please stay firm in your commitment to keep schools open in a normal fashion. I appreciate the leadership you've shown thus far, and I ask you to please maintain that. Additionally, I'm concerned about multiple accounts just this week. I mean, we've only had a few days of school, of teachers asking students during class to raise their hand if they were vaccinated. Multiple accounts of this. They are asking minor students to share protected health information in a public arena, which violates their privacy. Calling them out in front of others is social shaming. And I don't like to misuse the word bullying, but we have a clear power differential between a teacher and students, and it really could be in that case. It's definitely harassment. It's creating a hostile environment. The Knox County School website states that one of its top priorities is to create a positive culture. That is not done by singling kids out in this manner. You on the board have a mission to support our students, and I'm asking you to swiftly nip this behavior in the bud. I'm asking you to please enforce a culture that allows students to learn in an environment that does not harass them. I don't want anybody bullied for wearing a mask or not wearing a mask, for getting vaccinated or not getting vaccinated. Those questions have no place in the classroom. We have many amazing teachers and principals. I know my students have been very fortunate. And when they have concerns, they have the teachers' unions to advocate for them. Your priority as a board is to support our children. So please help keep the school culture free of this intimidation and nip these illegal practices of harassing our children over their protected health information in the bud. Thank you.
Amelia Peterson.
Hi, I'm Amelia Peterson. I live in Knox County, and I'm the mother of 3 small children, one who is starting first grade at Beaumont Magnet Academy this year. I wrote a letter to the parents and school board members who are against a mask mandate, and tonight I'll be addressing the board members. I shared this with parents at another time. I hear you. Individual rights are important. No one wants to be told what to do, how to live, or what's best for their own child. We all want our children to be safe and healthy, and not just healthy, but thriving. And seriously, masks are scary. They make us feel uneasy and weak and vulnerable. They remind us of death and make us feel trapped. I hate having to wear a mask too. I hate having to buy tiny masks for my children's tiny faces. I get all of that. But here's what I need help understanding. How do I explain to my first grade daughter that she needs to wear a mask in school so that she doesn't expose others to COVID? But other kids don't have to wear masks because their parents want them to have a normal experience, and personal choice is more important than the health of a community. What about when she asks why she has to wear shoes to school? Does she get a personal choice in that decision? No, that would be ridiculous, right? Easy answer. You might step on glass or get sick or spread yucky germs. Our health is important and shoes keep us safe. Boom, mom of the year. Okay, what about when she asks why she can't wear spaghetti strap tank tops to school? Should I say that it's because girls' bodies are too much of a distraction in an educational environment? Or how about your shoulders could keep boys from reaching their academic potential? Or should I tell her that she has to wear certain clothes because she's responsible for the thoughts and actions of boys and men? But don't worry, you don't have to wear a mask because you're not responsible if you give your friends a virus that could kill people in your community. Am I communicating to my child that her tiny shoulders are a greater threat to her school community than a deadly pandemic? Am I teaching my daughter that her body needs to be covered when it threatens the academic achievement of boys, but not when the physical health of her entire community is in jeopardy? And is the school I'm sending her to endorsing or enforcing these thoughts? If a mask is a violation of personal rights, then so is a dress code. And I don't see a lot of parents protesting Knox County Schools' dress code policy. We frequently accept the loss of personal freedoms in order to be part of a community. The clothes we wear, the language we use, the way we drive, the food we eat. We even adapt to sacrifice greater freedoms when living in dangerous circumstances. Think of all the freedoms that our armed forces sacrifice when deployed so they can operate efficiently and do their jobs well. Think of the personal freedoms our medical community has had to sacrifice this year to keep us safe. To be a part of any organized, healthy community requires some abandonment of personal freedoms. So why are we digging our heels in on whether or not to wear masks? Do kids really find masks to be so horrifically oppressive, or are we projecting our own experiences of a traumatic year on our kids? I don't believe I'm asking too much of my children to wear masks just for a time until we can protect them in other ways from this pandemic. I want my daughter to understand that while she is not responsible for the thoughts and choices of other people, her choices do affect other people. When this is all over, I want her to know that I did everything I could to keep her and our community safe. But most importantly, not only her. I also wanted to say, I know we've talked a lot about, no one should decide for my child what's safe for her. I 100% believe that every parent in this room believes that, cares for their child, cares for other children in the community. I think one of our biggest challenges as a community, especially in this really difficult year, is that we've been so separated from each other, and our only source of connection is through the internet and through Facebook and through Instagram. And we're reaching out, and we're trying to connect in those ways, but those ways are separating us, and that we are able to create these separate realities in which one person fully believes that they've done the research and that masks don't work, and another person fully believes and they've done their research that masks do work. And there's an information gap here. And so we need your leadership and your guidance to provide us with experts who understand and can communicate in ways that we can all hear and receive. We need our leaders to step up. And I know that this is a new virus. This is a new experience. We've never been through a pandemic together as a community, and it's happening all over the world. And if we don't find some way to communicate effectively and provide information that is reliable, that we can trust, then we're never gonna understand each other. And we need that desperately right now. Thank you.
Margaret, I'm probably not going to say this right. Nicole? Is it Margaret Nicara? Okay, sorry, and I probably said your name wrong, so I'm sorry. If you'll state your name and county of residence.
It's Margaret Niquara. You were very close. Knox County. I'm here to represent, excuse me, just some of the special needs kids, like my daughter. And the only reason I brought her is I couldn't find childcare tonight. So the mask mandate isn't about the parents. This isn't about me, and it isn't about the issue of personal liberties that some people mention, because this isn't a personal problem. This is a community issue at which schools are in the center. That is what will keep our children healthy and safe during this school year. That's it. And overwhelming evidence from the CDC and other health professionals tell us that wearing masks is an effective way of doing that. We did it last year, and it helped to keep schools relatively COVID-free. In the light of the explosion of new cases, I urge you to do what, as a board, you decided to do, which was to follow CDC guidelines and mandate masks in the classroom. This is particularly important for kids like my daughter who cannot wear a mask. Uphold your duty of care to these kids and make the right decision. Many people have chosen not to be vaccinated, and it is used to further spread, the virus to spread. Because of this, we need to use this mask mandate as our last line of defense for these kids that have to enter an indoor, crowded, largely unvaccinated building every day. This is not about what Glenn Jacob wants or what we want. None of us want any of this. This is about doing what we can, and what we can do and what this board can vote on to do is to keep our kids safe. And as someone else mentioned before, we should do anything, even if it's only a possibility that it might help. Why don't we do everything we can? Not all kids are healthy and will be able to bounce back. Thank you.
Thank you. Lisa Taylor. Please state your name and county of residence. You'll have 5 minutes to speak.
My name is Lisa Taylor, Knox County 37938. I really did not come prepared to speak this evening. If I didn't hear some other things already mentioned, I was going to lay low, but I have heard them. I just want to reiterate just a few things. Last spring, when the discussion regarding the reopening plan was discussed, many of us parents and community members just asked for consistent information across the county. As parents, we have simple expectations that all things would be said and done at all KCS elementary schools, or the same things, I should say, would be done at all KCS elementary schools, all KCS middle schools, all KCS high schools. We've only been in school for 2.5 days, and as some other parents have already alluded to, I have heard the same things, that there have been middle school teachers who have asked the students in the class to raise their hand if they've been vaccinated. I have heard administrators at assemblies this week who have praised and thanked the children who are wearing masks, who, at least in my child's school, was a small minority. And again, that's their choice, and I have no problem with that. But at the same time, the students who were unmasked felt that they were doing something wrong, or almost belittled, or if you want to use the word bullied, that's how they felt, some of them. I just think, I don't know what was communicated behind the scenes to, staff and administrators, teachers, what have you, but it still seems like there's inconsistencies across the board from the elementary schools all the way to the high schools. Really, that's all I'm asking as a parent. If we can make that happen, and clear statements are made to these folks that say, you can't ask the kids in the school, in your class, if they've been vaccinated. That's just it's like, it doesn't happen. We can't do that. If we could just kind of come to that agreement, that's all I would ask of the board and those who are in charge of making those kinds of decisions. I just don't think that we're making things even more divisive for our children when they're sitting next to their peers, and this student is wearing a mask and this student isn't, and this student's being praised for wearing a mask, and this student has an administrator saying, I hope you've been vaccinated if you're not wearing your mask. I mean, can we just make a simple statement and let them know what the policy is, and that's it? So if we can just reiterate that, that's all I would ask. And lastly, I just want to say I'm a healthcare professional as well. For 25 years, I worked in Knox County. I understand that everybody has an opinion about, all of the things, the masks, the vaccines, whatever. But we have to understand that this country is, and probably the world really is, 50-50. You can take this group of healthcare professionals who all went to the same schools, who had the same training and education, who say this, and these people over here who say differently. So when we say, listen to the science, listen to the science, you can hear whatever kind of science you want depending on who you're listening to. So I think it's just important for us to remember, no one, I think we've already realized that no one is ever going to agree on everything. None of us will. COVID is not going away ever. I think for those of us who may have once thought that, you know, we want to get back to normal, we can't get back to normal, we can't wait to get back to normal. I don't think as a person that lives in this society that we're ever going to get back to normal. We have to understand what we're going to do moving forward. And our children, masking and vaccines, those shouldn't be the things that we're concerned about. We should be concerned about their education and the test scores and all of the things and setting them up. And, you know, we want to create these great programs for them for, you know, the trades and those kinds of things. Let's focus on those things. We've got money and we've got resources. Let's just focus on these things. Let parents make the choices for their children and we can move on. And that's all I have to say. Thank you.
Thank you. Steve Burleson. Am I saying it right? Steve, I think Steve Burleson. Oh, okay, I'm sorry. Please state your name and county of residence, and you have 5 minutes to speak.
Good evening, everyone. Dr. Steve Burleson, Knox County. 18 months. We are all exhausted. We're exhausted about talking about this and dealing with this. As the young lady before me just mentioned, just a quick little history and virology here. This is the COVID virus, respiratory virus. It's not going anywhere. Just like the flu or the cold. This is something that we'll be dealing with 10 years from now. This will still be a seasonal, maybe bi-seasonal issue that we will continue to have to deal with. Now, I get people on both sides. I get people with masks on, they're afraid. You know, with less education, less knowledge of what's really going on, I'd be afraid, you know? And then people on the other side, I get why they're afraid and they want their freedoms back. So I get both sides. But what I'd like to do is if this works, great. If not, I'm just gonna kind of go over a few topics. One of the things I want to say is really cool is that going to drop my kids off we're at A.L. Lots, great school, we love it. Parents have the last 18 months have been educating themselves on everything that they can do to possibly do the right things to make sure their kids and their family are safe and healthy. So when we drop our kids off, though, we're seeing probably maybe 5% of teachers and students wearing masks right now. So that tells us that the majority of the people do not want to wear masks. Now, we have a pretty big mask population here today, and, you know, kudos to everybody who showed up to, you know, have their voices heard. But when we look at the grand scheme of things, the majority of the people are done with this. And there's going to be a huge population of the student bodies that's probably going to pull their kids out of school if we keep going towards these mask mandates. A colleague of mine recently did a school board meeting similar to this, and I was kind of going to reiterate some of the stuff that he had said, but I'm going to try to see if I can play his, I think I can get this in, his presentation. He did a really good job of just kind of illustrating kind of what we're dealing with right now.
Hold on just a minute. I'm not sure that.
Indiana.
Please stop that. Hold just a second.
To address your comment, geez, it's hard to believe we're 18 months into this and still having a problem. And I would suggest the reason we still have a problem is because we're doing things that are useful and we're getting our sources of information from the State Board.
Please turn that off for just a minute.
Yes, ma'am.
Yeah, if you would like to speak about your thoughts, that is
that's
allowed.
fine. That's fine. All right, so we talk about the CDC and the NIA and the research that they're saying about wearing masks, not wearing masks. The CDC and the NIA have got multiple studies illustrating that masks don't work. Now, if anybody wants this information, please don't interrupt me.
Excuse me, let's respect everybody that's speaking tonight.
If you want this information, please come to me and I will gladly be able to provide that to you, sir. This is an absolute fact. We've gone back and forth on this, and we are looking at a situation where we are looking to control the population off of something that's been basically fear factors, what we've been under. We talk about vaccinations. Vaccinations will, what their goal is for, and this isn't really truly a vaccination, it's a therapeutic. And what its job is to do is to decrease symptomatology if you do catch it. It does not decrease the passage or contraction of the COVID virus. So we had a member last week mention if everybody gets their vaccinations. Well, that's great. Let's say everyone does get the vaccination. That does not decrease the chance of the transmissibility of COVID. It will still pass. Just as the NHL, I think, had a mumps outbreak a few years ago in a mumps vaccinated population of the NHL. Well, the reason why it passed is that the virus will still be contracted into the individual and it can still be passed out. So vaccination, we got to understand that it's not going to decrease the transmissibility. So that's one thing. We talk about the PCR test. The PCR test has a huge false positive rate, up to anywhere 60 to 75% false positives. This is why at the end of the year, they're canceling the use of the PCR test because it doesn't work. And we've been utilizing these tests to keep track of COVID cases, which is it's just crazy. And we talk about the number of children right now in hospitals right now that have been diagnosed or have been tested to have positive COVID. These aren't children that went into the hospital because of COVID. There are children that went into the hospital, had a PCR test, and the PCR test said they had COVID because they need these type of tests to be admitted. Now, if you have a test that has over 50% false positive, and these children are going in, they're not going in because of COVID, but they are being tested, and this is why their numbers are where they're at. Now, we can all be, again, being smart, washing our hands, taking the things that we need to be doing to keep ourselves safe, but by masking ourselves is not going to change anything. They can continue to deal with this pandemic, if you want to call it.
Thank you very
moving
much.
forward. It's not going anywhere.
Naomi Elliott. You'll just state your name and county of residence, and you have 5 minutes to speak.
Naomi Elliott, Knox County, Tennessee. Hello. I was hoping I didn't have to spend my time to be here again, but unfortunately that's not the case. Here I am after everyone came to an agreement last year that much too much of this board and the public's time was spent discussing this same exact matter. You've had facts after facts after facts presented to you, but yeah, I feel like we're wasting taxpayer time and money. I mean, I understand that as a board, you would want to address concerns of citizens. I don't know what the percentage is for every school, but my child said it's about half and half for the children and the employees of Knox County Schools wearing masks. I have no problem with people wearing masks if they do it hygienically, but the problem is you can't force people to do something that they're not ready and willing to do. This is why following our conscience and having that God-given freedom is such an important thing in life. To think that we should oppress half of the population to appease the fears of the other half, that's ridiculous. Where's the logic in that? I mean, if you think there's logic in that, I question the board. I question Knox County Schools as far as educating students, because it's simple. You have the science, you do the math, do the statistics. I know there's a lot of deception out there, but if you're a critical thinker, it's not that hard to get to the truth. Most times the truth is hidden in plain sight, but we're often distracted or too busy working or with our family or whatever it is that consumes all of our valuable time in life. We don't get time back. Every second that every one of us is breathing on this earth is precious. Everyone matters. Everyone. It's really sad to see our nation so divided. I mean, even on the local level, seeing how, the county's divided. We could play the blame game all day, and I'm sure that we all have a role to play in this. Parents, educators, public policy makers. I could go on and on. Probably churches. I mean, I can't leave them out. Families of faith, people who, try to do good and live right and have good morals and live out their faith through serving others and loving others. Isn't that what life's all about, is love one another? I mean, that's the golden rule, right? Treat others how you want to be treated. I mean, if I have a fear and it's irrational, now some fears are rational, but if I'm telling you that you should be harmed because I'll feel better, that's wrong. That is very wrong. I mean, is it that difficult to convince people that good is evil and evil is good? I don't think so. I mean, look at the Milgram experiments from, I think, the 1960s. The conclusion was that people will obey authority even if they feel that they're doing wrong and it's causing harm to others. We're taught that it's good to obey. I want my child to obey her teacher and her educators. That's the respectful and the right thing to do. But I don't want her to obey them if they are in the wrong. I want her to take a stand. But these children are so easily molded. Their minds are still being molded and conditioned, and we shouldn't condition them in fear. Viruses are a part of life. I mean, coronavirus killed President William Henry Harrison in 1841, the first president to die in office. We didn't shut down the world and take people's freedoms away and oppress them because we feared that we might get sick and die like he did. That's irrational. I hope if I didn't hurt anyone's feelings, that wasn't my heart. And I hope you can understand where I'm coming from. And I hope the future gets better for society, and especially for education, because that's the future of society. Thank you.
Thank you. Brooke Davis.
Brooke Davis, Knox County. I'm on it. Okay. I'm a little nervous. I've never done anything like this. Thank you for allowing me this time and platform to voice my thoughts and opinion. I'm very passionate about what I think and feel about this. I have a fourth grader and a kindergartner in school this year at Rocky Hill. First off, I would like to share a study that masks have been proven to work for protection in COVID-19. Wait, there is no study. I can't actually share it because it doesn't exist. The chief medical advisor to the president, Dr. Fauci, said in his recent emails, retail masks do not work. This virus is small enough to spread through material. The NIH has done studies stating the psychological damage to our kids will be worse than we can even imagine. In my own home last year, we all contracted COVID. We all survived, yet we all suffered loss in our family from this disease too. I do not diminish this disease and the severity of it. I need to make that clear because my family lost a grandfather, a father-in-law, a stepdad, an uncle, all to COVID-19. But the mental toll on my kids was clear after 9 months of being in a mask. I'm sure if we look at the test scores, they were well below what the state would have liked for them to be. Their will to learn declined. Their joy of school or going to school declined, but their anxiety soared. How will my kindergartner who starts school in 2 weeks learn how to read and enunciate her words properly if the teacher cannot see her mouth moving? How will she connect socially to her teacher and her classmates in a mask? Explain this to me. How do I make my children understand if you can unmask at sporting events, lunch, recess, but not in a setting where you are being educated? How can I explain to her where the board can sit up here unmasked together tonight, not 6 feet apart? They also cannot comprehend at this age what anxiety is. It's an emotion they don't know how to express yet. Unlike myself that can verbalize how the mask affects me. So in return, their behavior changes. Their ability to understand the curriculum in schools is difficult because guess what? They're distracted. I never thought my child and myself would experience panic attacks together, along with some of her peers. Now remind you, she's 9 years old. It isn't funny. The fact that the mocking is happening tonight is a disgrace to our community in Knox County. The increase in antidepressant drug use speaks for itself. School is a place to socialize, play, learn, have fun experiences to make your child grow and thrive. But masking our kids or making them be masked and COVID-19 has robbed our kids of this joy. Their first day of school was Monday. And the joy and normalcy radiating in my neighborhood and in my community was awesome. I was so excited, and that's why I stand here today to advocate for my kids and my community. I'm asking you to let us, the parents, decide what is best for our children. Unless you or Knox County is going to provide N95s for us, my kids, the proven mask that works, then this is ridiculous. Just like you all have chosen, I already said that, sorry, I was gonna call you out on not wearing a mask again. Let that slide, got my notes all mixed up here. Again, it should be parents' choice to mask our kids. Please make masks an option for me and other parents in Knox County Schools. Thank you.
Thank you. That concludes public forum.
Thank you, Ms. Bab. Ms. Henderson?
I just have a procedural question. Since this motion was added late to the agenda, is there a way to suspend policy B180 to allow anyone else on either side to speak in case they want to? Is that possible?
You can make a motion to do that.
I would like to make a motion to suspend policy B180.
Okay, we have a motion by Ms. Henderson and a second by Ms. Christie, and that policy is the public forum policy, is that correct?
That's correct.
Okay, so do we have discussion on that? Your lights are on. Do you want to speak to this? Okay, Ms. Babb?
I guess I'm a little, just explain to me what she's talking about, to be honest.
Okay.
Since Mr. Watson put the motion for late on the agenda, I just want to make sure if there's anybody else who wants to speak in regards to his new motion, that they have that opportunity to do so.
So I think your point is that the original agenda item was discussion and possible action regarding the board and superintendent's authority concerning the implementation of public health protocols. So this is a very different motion than what was on our agenda. Okay. Thank you, Ms. Henderson. Thank you for the question, Ms. Babb. Okay, any other questions or comments? Okay, all in favor? Any opposed? Okay, we have 2 opposed. Okay, so motion carries. Okay, so can I make a motion that we take a break before, I already had this in my mind before, that we take a break before our discussion with the expectation that board members will not discuss Mr. Watson's motion during the break. Okay. So, okay, so do we have anybody that would like to second that?
I'll second that.
Okay, so we have a second. So any discussion on taking a break with no discussion during the break? Okay, all in favor? Any opposed? Motion carries.
So if you're needing to speak, please come forward now and I will take further names.
So we will meet back here. Let's try to meet back at 7:15. So that's literally a 6-minute break. Okay, 7:15. Okay, we're going to get started with a few more public forum folks. Ms. Bab?
Thank you. Since we are doing this as an addition, we are going to do a limitation of 3 minutes for all speakers, just to let people know. But we are happy to hear from everyone. I'm going to start with Tina Shields. And if you'll state your name and county of residence, and you'll have 3 minutes to speak.
Hello, my name's Tina Shields, Knox County. My daughter was the one who spoke earlier. I wanted to actually talk to you about contact tracing. I have an 18-year-old special needs student with Down syndrome. First semester last year, he was contact traced 3 times. And halls shut down for a week, and then the whole school shut down for a week at Christmas. So he missed 8 weeks out of 18. The weeks that he was home, he did nothing, literally nothing. His PE class met and they did a little bit of stretching. And other than that, nothing. He had 3 classes that opened up. He had work sent home. He doesn't know how to use a mouse. He doesn't know how to find on a screen where he's supposed to click to make something work. He doesn't know how to read it. So if it didn't have a recording that he couldn't find how to click on anyway, he's just sitting there staring at a screen. He had paperwork, but we're working. I wasn't able to work with him. So he got to the point that he literally, if he had to go by the office, he was hugging the wall and looking away from the office because he was afraid to go near it because they were going to contact trace him again. Now, he's a special needs student. He has legal rights to his education, and those were not met last year. I don't like to go down those kind of routes. But if I was to choose to, I mean, that is a lawsuit. I just want my child to be educated. I want him to be happy. He is living his best life. And I see a lot of my friends with special needs children asking, please get vaccinated, please wear your mask. But what they don't understand is that by giving up their freedoms and asking us to give up our freedom, the more freedom we give, the less control we have. And at some point, we have no choices. And at that point, my child becomes disposable, basically. He has no value to a society that doesn't value freedom. He's not worthy of labor camps. And I'm sorry, that's where we're heading. They're trying to take our freedom. And my child will be meaningless. So when we give up our freedom by making people wear masks, by making people get vaccinated, at some point, the children that you're trying to protect, it won't matter because they're going to do what they want to with them anyway. Contact tracing needs to stop. The kids that went home, they sat there and stared at the walls for 2 weeks and then went back to school. Very, very few of them ever got sick. And that we know the tests are faulty. Let our kids go to school. Let them see each other smile. Let them just socialize and be kids. They're resilient. And I'm a special needs parent, and I want my kid unmasked. Thank you.
Thank you. Elizabeth Wagner. Please state your name, county of residence, and you have 3 minutes.
Yes, ma'am. Elizabeth Wagner, Knox County. I was not planning on speaking tonight because last year we were told over and over and over again that the board did not want to discuss this anymore. I'm right there with you. I don't want to discuss this anymore. I was honoring that. I've sent very, very few emails because I believe that your time is valuable. Again, I was honoring your request. I've stated my case before. However, it seems that we are once again discussing because we didn't have the outcome that some people may have desired. Just to be clear, the students in my children's middle school and elementary school, I have 4 students in Knox County. They are stating that there are very few students that are masked. We spent last year in a mask. My 4 children went with a mask, all 4 of them. We complied. They hated it. Daily, we had headaches, stomach aches, tears about not wanting to go to school, issues making friends in an environment where they can't see each other's faces. I picked up my students more times than I'm even comfortable with, simply because they struggled so hard with wearing a medical device that restricts their airflow. Uniforms, they aren't medical devices.
Medical devices should be a decision for parents and their healthcare providers. Your children might need insulin to stay alive. Mine doesn't. I'm going to decline any medical intervention that would harm my child. My child needs air. She came home more times than not last year in tears. I'm talking about my 8th grader. Mental issues are real in this pandemic, and if you don't know that as an adult, I question if you're paying attention. One issue does not trump another. I'm trying to protect my child from having to wear a medical device, and you're trying to protect your child by wearing a mask. The difference is I'm not fighting to take away your right to protect your child. I don't want to take away your parental rights to do what's best for your child. Please respect my right to do the same. I would like to also add, I don't believe this board has the ability to instate a mask mandate. Somebody brought up the governor, but last time I checked, he's not an interpreter of the law. We have an interpreter of the law that told us that this board does not have the legal right to issue a mask mandate. I implore the board to move on from this issue. I ask you to let us focus on educating our children. I ask you to continue to focus on the declining test scores that our superintendent emailed about this evening. I would like to focus on helping our smallest students learn how to read. I would like to see those students be able to see the lips and facial expressions of their teachers. I would like to talk about how we're going to ease our children's anxiety from the fear that we've instilled in them. I would like to focus on letting our children play instruments. I would like to focus on the arts again. I would like to let them be able to experience the things that bring joy and life to their schools. Please continue to let masks be a choice for our parents and our students. I appreciate your time. Thank you.
Thank you, Debbie Stafford. Please state your name, county of residence, and you'll have 3 minutes to speak.
Debbie Safford, Knox County, Tennessee. Thank you for having me. I also wasn't prepared to speak. So I'm here as a nurse practitioner. I'm Nurse Debbie of Nurse Debbie's Health and Wellness. COVID has significantly increased over the last few weeks. I think yesterday alone, I did 6 cases of COVID out of about 17, 18 patients for the day. COVID is changing. A year ago, when someone had COVID, we pretty much could tell if you lost your sense of taste or smell. Now people are coming in with what look like regular sinus infections with no loss of smell or taste, and I'm testing them. They're coming up positive for COVID. We know that the tests are not 100% accurate, but anytime we get a positive test, we must assume that it is and treat the person as such. The big thing is quarantine. Stay home for those full 10 days or until you're feeling better. Don't go out in the community. Don't do what so many people are doing and thinking a mask can protect you or a mask can protect your neighbor and go out with active COVID into the community. And that is but one of the problems with this masking. When it comes to children in Knox County Schools, my children are all graduated. There is no way I would be sending my children to school in a mask. It doesn't work. And I know that there are people that have been here that swear up and down it will work, and they have the right to put on their face and constrict their child's breathing to the point that they feel is appropriate until we can prove that they are causing child abuse to their children. For those people who feel so adamant to force their children to wear a mask, you have that right as that child's authority, and I respect that right. But I will tell you to please consider the profound mental health conditions that you are potentially instilling in your children. It is not healthy for a child to think that they are a disease vector going around killing their grandparents and their neighbors. It instills a very negative self-esteem. It can set them up for lifelong fears of germs that cannot be undone without significant lifelong intensive therapy and medications. And I'm going to finish with something that's extremely unpopular. It is okay for kids to get sick sometimes. It is okay for children to catch colds. It is okay for children to go out and roll in the dirt. It is okay for children to make mud pies. It is okay for children to build a healthy flora. We do know that antibiotics and over-treating them with medications that they don't truly need can cause them bigger health problems than what they had. So for goodness sakes, let's treat COVID. We've heard Dr. Childs speak and state that up until now, the majority of children who have had severe COVID are obese. Okay, those of us in masks and those of us without masks, what are we doing to decrease the obesity? I've had lifelong obesity. I'm working on a diet. I'm never going to be thin, but I'm going to try and be thinner. but work on what helps. Get to a healthy weight. Thank you.
Sarah Wilson. Please state your name, county of residence, and you'll have 3 minutes to speak.
Sarah Wilson. I'm in Knox County. As many of the others, I was not planning to speak to you, and I do much better when I write down what I want to say because I get flustered with public speaking, but I will attempt to try to get my point across. A friend of mine is an elementary school teacher, and she's trying to watch the board meeting. She texted me as soon as she saw I was going to be able to speak, and she said, if you speak, please speak on my behalf. You can tell them I couldn't be there tonight because of Parent Info Night. I cannot do my job in a mask, nor can a student learn to produce sounds and words in a mask, much less pick up on social cues, etc., which is so imperative in the elementary school age. So that is from one of your teachers in Knox County who is basically begging for you not to do this. Also, I sent you guys an email a couple of days ago. I'm just going to read some of that, and more so for our parents than for our board members, because I'm hoping that you all do read your emails, and I know some of you do. So at the board meeting last week, one of the members went back and forth with our law director asking, was it that he found that the board did not have authority, or did he not find anything to support the board having authority? The school board receives its authority directly from the legislature. The only authority the school board has is what the legislature has expressly given them, nothing outside of that. The board does not have any authority unless it is given to you. Your authority starts and ends with education where it should be. The legislature has not given the board any authority over health decisions for our children. That choice lies with parents and them alone. Our law director, and I know Governor Lee came out and said what he said as far as school boards having the authority, but Governor Lee is not a law interpreter. We have a law interpreter, and he sat here last week, and I believe, I could be mistaken, but I believe there was another time where we've also had a lawyer come to you and say, this is not a route you want to go. It is not a legal route. But our law director also last week referenced Dillon's rule. Dillon's rule is if there is a reasonable doubt whether a power has been conferred to a local government, then that power has not been conferred. If the legislature has not expressly given you that power has not been conferred. So the problem with public officials that ask questions like that is it comes across as if they're looking for power and control, and I have an issue with that. As a freedom-loving American, I have an issue with that. It is not your place in government to try to control people and tell them what to do. It is your place as the board to make sure that our kids get a quality education. And I know for my kids, that did not happen last year. So I hope that we have a different outcome this year. Thank you. Oh, also, as we were sitting here, the Tennessee House has called for a special session concerning this. So just thought you'd want to know that.
Deborah Howard.
Deborah Howard. Is it on? It is. Knoxville, Tennessee. I also was not going to speak. I wasn't even going to be able to make it, but when I heard that things had been brought back up, I felt like it was my responsibility to come down and speak again, even if it's just to say which way I wish y'all would go. So thank you for hearing from all of us, including the ones after, because I know that's an additional time that you didn't have to give necessarily. It is good to air this all out, although I think we all wish it would just be done. I forgot to say last week, I think some of y'all probably know I'm a mom of some Knox County students, but I forgot to say that I am. One of mine graduated this year, so she's going to go off to college, but I have another one who is in high school, and this morning, because I happened to be off today getting my daughter ready to go to college, I was able to take him to school. And it was just so refreshing and wonderful to see all of those high school students interacting like high school students should interact. The little ones need their interactions. The high schoolers need their interactions. I mean, my son is a sophomore. For heaven's sake, his whole freshman year, he was in a mask. He didn't know if some girl was smiling at him or not. I mean, that's not education, but that's part of them growing up and learning how to interact. You know, I'm also a PA in the area, and the experts that people have been talking about today, you know, someone came up and did say the PCR tests are faulty. They're going to stop using them in December. I don't know why they're going to continue till then. But if you have a faulty test, you know, the cycle threshold's too high, all the false positives and all of that. In fact, you know, the crown prince of all of the experts that we have, Dr. Fauci, you know, flip-flopped on masks multiple times on TV. So how people don't see that, I don't know. You know that physical health consists of healthy habits, healthy food, plenty of water, lots of rest. But the mental health, they need the interactions. They need to be with other human beings. They need to hug their friends. They need the facial cues so they can know how to interact and really know what someone is thinking or saying to them. You know, we got to think about the whole kid, not just masks and one virus. So please keep normalcy for our kids. They are so excited to be able to interact, you know, like they should be able to. We can't have them come to believe that being apart from their friends, 6 feet, you know, distancing, isolation, quarantining when you're not even sick, and masks are normal. That's not sustainable, and it doesn't work. Thanks.
Thank you. Alistair Elliott. Please state your name, county of residence, and you have 3 minutes to speak.
Alistair Elliott from Knox County. Same as everybody else, threw this together. One thing I heard earlier tonight is talking about the kids who are dying from COVID, having underlying issues. Since when is the school district just for healthy kids? We have lots of sick kids in the school with underlying conditions. Do we not care about them at all? What about their family members of the kids who are like the healthy kids? Because they probably have aunts, uncles, grandparents who have health conditions. We don't care about any of them. My brother at 14 was diagnosed with a heart condition. Nobody knew he had it until he got pneumonia and ended up in the hospital. He lived, but COVID is worse than pneumonia. How many kids are in the school district that may have a health condition that the parents don't even know about and they think they're healthy? We don't know. Somebody else mentioned car accidents and how they're like more of a risk. Well, yeah, we have laws requiring seatbelts. We have laws requiring that we have lights that work on our cars so that, because it's regarding safety. We have regulations on the auto industry to make sure the safest cars are on the market and that we're not putting unsafe cars to put people at risk. We have laws all over the place to help keep us safe. We're not even talking about a law. We're just talking about the school district putting in a mandate for masks. The doctor who talked earlier is functional medicine. That's pseudoscience. He introduced himself as doctor because I guess he'd make people think he was an expert on the topic, but as the previous speaker said, like percussionist, acupuncture, whatever he does is not viral medicine. He does not know about viral medicine if he's doing functional medicine. They're two completely different things. He's not an expert. All of this other stuff we're hearing, it's melodrama. And personally, I'm cool with theatrics. Like, I have fun with it. You guys have seen me up here as a satanic minister. There's a time and a place. And when it comes to the safety of our children, it's not the time or the place for melodrama. Like, kids need air. Come on. We've been walking around with masks for a year and a half. And I mean, me and my friends were still alive. How many kids in the school district died because they didn't have oxygen last year? Anybody? One single kid? Because all our kids were wearing masks in school. They all survived. They're all doing just fine. They all got their air. Like, lifelong fear of illnesses? Come on. We've had illnesses all the way around. We take precautions against different kind of illnesses. It's not going to create a lifelong fear. That's ridiculous. It's melodrama. Like, end result here, if one single child dies this year because they contracted COVID in the classroom, it's on your hands if you don't put a mask mandate on. That's probably why you don't want contact tracing, so you can have a guilt-free conscience there.
Thank you. Sherry Garrett. Please state your name and county of residence, and you'll have 3 minutes to speak.
My name is Sherry Garrett. I'm in Knox County. There are actual studies that prove masking works. I would love to see it. I have seen data that proves masking does not prevent the spread of any virus. There's 40 years of studies that have proven that. Please provide that data. We even heard tonight from a data analyst who provided zero data. As a nurse, I know how to prevent the spread of contaminants from patient to patient. When you wear a mask in a healthcare setting, you put your mask on, you do what needs to be done with that patient, then you remove it, put it in a biohazard containment, and then wash your hands. Then you don another mask to take care of your next patient. And then it's been proven that hand washing prevents the spread of contaminants such as COVID-19. If you're wearing a mask and you touch it, you contaminated yourself, possibly with COVID-19, you need to wash your hands. But children and teachers have been wearing the same masks for hours, touching it, touching surfaces, spreading viruses everywhere. So if you can provide me with a study that proves beyond a doubt, then please get it to me, because after 18 months of searching, I have yet to find one that is not opinion-based or supposition. And I must remind you that masks are not articles of clothing, as been stated before when they were talking about uniforms. Per the FDA, they are medical devices. I'm going to end with this. I just received information, and I think one of the other ladies just touched on it a minute ago. I'm going to repeat what Speaker Cameron Sexton said in the House. Parents should make and be in charge of their children's healthcare decisions. Unelected bureaucrats and local entities taking away parental choice destroys their freedom and liberty. We need to stand with our parents and teachers. They'll be calling a special session in the House to discuss parents' rights to make healthcare decisions for their children versus the government's ability to mandate them, preserving our freedoms and liberties, stopping unelected bureaucrats and unelected officials from making health decisions involving children and businesses, protecting Tennesseans from COVID-related discrimination, ensuring educators are appropriately compensated for COVID leave, and additional COVID-related issues. Thank you.
Thank you. Okay, I'm sorry, I can't read the first name of this, but it's Miss Harley, or Harley is the last name, sorry. Sorry about that. If you can just say your first and last name.
It's Wendy Harley. Wendy.
I'm sorry.
Wasn't tricky.
I'm not laughing about your name. I just could not read it. So thank
no,
you.
You're fine. You're fine. So I bought into the mainstream news, hook, line, and sinker, from the Italy stories, let my anxiety get built up. I'm a registered nurse. I thought, oh, I need to be paying attention to what mainstream media is showing me and everything. Well, obviously, I forgot all logic and everything that I've learned in my nursing career. And part of that was because I was mourning a brother that I was losing to cancer, who didn't get his last treatment. Now, that doesn't have a lot to do with the school board and our children and everything, but everybody's being affected. Now, what's interesting is I listen to doctors who have been censored. You got to ask yourselves, why are they being censored? Maybe they have something good to say. Maybe they're speaking truth, and the majority doesn't want to hear it presently. And another good rule of thumb is, if you look at what the science, what CDC and all this was saying before the pandemic, it was that masks don't work. These viruses are super tiny. And if you look around, oh my gosh, she took it off. A virus just went in that mouth. Another one went up her nostril. When they go into the restaurant, did you know that the COVID particles hover? They don't go down when you're sitting. And let's see, there's just all kinds of ridiculous things. But once I started searching for the truth, I was able to find it. And the thing is, I'm high risk, right? These children that are special needs, yes, they're high risk. But guess what? There are safe, proven over 65 years of treatments that are cheap. And guess what? It doesn't include a vaccine. That's a lot of money. It's called hydroxychloroquine or ivermectin, or both if you have long hauler symptoms. If you're lucky enough to deal with that, then you need to find a doctor that will prescribe you that. And you need to find an independent pharmacy that's not controlled by big tech. And I would say, it's great that we're putting a lot of stock barrel into our school board, but guess what? Our U.S. civil rights are protected. And I have a religious belief that I need to breathe through my mouth. And so for that, I will never put on a mask, and I will be protected by federal law 28 CFR 36.202, which prohibits anybody from allowing me to enter based on their mandate, because I lost my train of thought. Because they believe that I need to be wearing a mask. If they're that afraid, they need to stay home. Thank you.
Thank you, Erin McNeil. State your name and county of residence, and you have 3 minutes.
Erin McNeil, Knox County. So I am also a nurse practitioner, and I had a grandmother that died from COVID. But I wasn't prepared to talk tonight, and I jotted down some things that I wanted to say. There's a peer-reviewed journal article that I found this week called "Imperfect Vaccination Can Enhance the Transmission of Highly Virulent Pathogens." There's also a study in Israel that studied natural immunity and found that natural immunity is far superior to vaccination. Other thought I was having is this COVID's never going to go away because there is an animal reservoir for it. Even if there's herd immunity, there's still going to be an animal reservoir, so it'll be passed on just like the flu. The other thing is PCR tests don't differentiate between the Delta variant and regular COVID. I wasn't sure about that myself, so I called several places to see if they could check just to see if I had the Delta variant, and they don't. Another thing is that the CDC, they're not reflecting in their numbers people that have COVID that were vaccinated. Those numbers aren't available. And then there's a lot of information on the VAERS reports in CDC about the COVID vaccine. And another thing is vaccines are not FDA approved yet. So they're essentially experimental treatments. And with experimental treatments, you need informed consent, and they should never be done on vulnerable populations. It has no long-term studies yet. So I would, be really concerned about vaccinating children until you research yourself. I would look at the VAERS reports. There's been cases of myocarditis. The former Pfizer chief recently stated that children are 50 times more likely to die from the vaccine than COVID. I would pay attention to your confirmation bias. We have a history in this country of practicing science, things in the name of science, based on experts like mandatory sterilization, electroconvulsive therapy, chemical restraints on people with mental illness. And so that's it. That's all I could think of. Thank you.
Thank you. Jennifer Stombaugh. Sorry if I mispronounced your last name. Please state your name, county of residence, and you have 3 minutes to speak.
Hi, I'm Jennifer Stambaugh. First of all, I wanted to clarify, I'm publisher of Hard Knocks Wire. You've seen me running around taking pictures and doing stories. I am not here as publisher of Hard Knocks Wire right now. Name badge is going off. I am here as an educator with Knox County Schools and as a parent of a student in Knox County Schools. First of all, anyone talking about learning loss, that's not an educational term. That is a political propaganda term. Educators did not create learning loss. That is a political term. I teach at Ridgedale with special education students. My kids learned last year despite pandemic precautions, despite wearing masks. My nonverbal special needs students learned, and if anything, made more progress last year than any other year because we did research on what needed to be done, and we implemented new technology and made changes and did what was right for our students. They learned. Secondly, lives are more important than learning. If we kill off all of our kids,
education doesn't matter. We can't teach to a classroom of dead kids. I've been to student funerals. People talk about the trauma of the pandemic and the emotional toll of all this. There is nothing more traumatizing than going to a funeral of a student. Nothing. My kid caught COVID last year. She is a long hauler now. I'm taking her to Vanderbilt Hospital next year. Anyone who doesn't believe that kids don't suffer long-term consequences from this is more than welcome to pick up my medical bills or hold my crying child at night and take over my responsibilities on that. Please, I'd love to have that burden lifted off of me. And I don't appreciate people who negate that as a myth. The science is clear when you look at real science. Real science is published in peer-reviewed publications. It is not published on YouTube or Facebook. When you look at the real science, vaccines have an impact. Masks have an impact. They're not 100%, but they do significantly improve the outcomes of this pandemic. Our hospitals are filling up right now, including children's, and that was before our kids came back this past week. With kids coming back in the classrooms, we need to put in precautions to keep our children safe and not have any more kids have the long-term consequences of COVID that my daughter is currently suffering. Thanks. Thank you.
Tanya Canby.
Is it Tanya Canby? Okay. If you'll just state your name, county of residence, and you'll have 3 minutes to speak.
My name is Tanya Cambry. I'm Knox County resident. I am standing before you guys tonight. I am not a doctor. I am not a nurse. I'm not going to claim to know any of the medical things that have been shared tonight. I'm here to share my truth with you guys and my experience. And I'm asking that you guys respectfully consider it as you vote tonight. Some of you guys may know me. I've served on various boards over the last several years on local, on county, and on state levels. I am going to make it very clear right now, I am not here representing any of them. I am a Knox County School sub. I subbed the majority of last school year. Nearly every month, I maxed out on my sub days. I'm not here as a Knox County School sub. I am here as a parent of 3 children in Knox County Schools. And I think, unless I missed it tonight, I'm also here as the only one that I'm aware of, as someone who is currently fighting something called PASC. It's commonly known as long COVID. I had COVID pneumonia in April. I subbed up until I got sick. Once I got sick, I was out for the rest of the school year. I was in the hospital twice. I've been diagnosed with multiple, and many of you in here that know me and know my journey, multiple life-threatening illnesses as a consequence of COVID, including several heart conditions. So what I'm going to say to you guys tonight, I am not taking it lightly. I've gone as far as researching medical documents outside of the United States because I am so over the political stuff that has come with COVID. I am not asking you guys to put masks on our babies in our schools. I'm not. I'm going to tell you why. As I mentioned, I subbed mostly in elementary school over the past years. And while we could debate until tomorrow the effectiveness of the mask, I'm going to tell you guys something that I learned that the kids thought that the masks were great for. They chewed on them. They shared them with each other because Buzz Lightyear is really cool, but so is Mickey Mouse. And so they would share them. They'd use them as slingshots, put paper balls in there and sling them across the room. I don't think they're as effective as we hope that they are. I can share with you what my doctors say. It's split down the middle. As many tell me to wear a mask, the others don't. So I'm just asking you guys, like I said, to consider what I told you as you vote tonight.
Thank you. Laura Clapp. Please
Thank
state your
you.
name and county of residence, and you'll have 3 minutes.
My name is Laura Clapp, and I'm from Knox County. I have 3 children in Knox County Schools, all too young to be vaccinated. We did virtual last year, which was not a bad experience, and the kids have been so excited to be back in person. They have loved their 3 days of school. They've happily worn masks to school. One of them is high risk, so we try to do what we can to keep the germs away. They've not had any problems going through their routine with masks on. I think we can all agree tonight that what we want is to keep schools open and to keep those kids in school and to keep them healthy. At this point, COVID is not a regular virus. It is harmful and new. Hopefully we won't have to deal with this forever because it will mutate to be less dangerous, but we're not there yet. We are all tired of this, but it is our responsibility to protect our children as much as we can. The experts say to do this, we need universal masking. That means everybody needs to be wearing a mask in school. It's not perfect. The kids touch things, they pull their mask down. It doesn't always work, but that is what has helped. And your kid wearing a mask helps protect my kid wearing a mask. Even if there's a minor chance that wearing a mask can help our children, why would we not do that? Why would we not encourage it? I've seen friends suffer from this disease. I want to do my part to decrease the suffering. Sitting here and doing nothing is harmful and a bad example to our children. We elect officials to govern us when we cannot agree on a solution to a problem, and I think we can see tonight that we can agree on it. COVID is a problem that's getting worse, and what we're doing now is not working. It's not slowing it down. We need to put these mandates back in place. I hope you'll listen to the experts and follow their advice and their recommendations. All over the world, people are doing this. It's not just our country and our politics. It's our responsibility to have compassion for our community and to show our children that we care for others. Thank you.
Thank you. Hannah Kirby. Please state your name, county of residence, and you'll have 3 minutes.
My name is Hannah Kirby, and I'm a Knox County resident. Thank you for the opportunity to speak. Thank you to Ms. Henderson for making the motion to allow everybody who feels so strongly about this issue to speak on it. Rather than get into the beliefs on masking that I hold, I do want to say that I respect each and every one of you for the service that you do for our county as elected officials. You all know that I have great respect for elected office, and that I want to see you all live up to the full potential of a Board of Education. And that is why I want to leave here tonight with a very clear understanding of the future direction of Knox County Schools when it comes to COVID-19 protocols. I think that in April at that last, I think it was the 14th meeting, everybody left with an idea of what would happen if the CDC and the Tennessee Department of Health changed their recommendations. When that happened, I think that a few people, more than a few, were surprised that Knox County Schools was not changing direction with them. And that's at the crux of the issue here. If tonight you all decide that you no longer want to follow through with that decision from April, then that's your decision. I don't think that any of you are going to have your minds changed on masks or social distancing tonight, because you've been listening to a lot of us in our opinions for months and months, and you have your sources and your experts that you hold in the highest regard. But I do think that consistency and following through on your word is really important. And if you do change your minds, then it needs to be a vote, and it needs to be clear. Everybody, lots of people on both sides have asked for that clear communication going forward. And if you do decide to change your minds, then clear communication to the families who would have made a different decision regarding virtual versus in person is also important. I know that you all have spent a lot of time listening to us speak, reading emails, and doing your own research, and I commend you for the hours that you've put into it. And I just hope that going forward, you all do uphold the integrity of the Knox County Board of Education, vote on something, and then follow through with it. So that's all I have to say.
Thank you. That concludes public forum.
Thank you, Ms. Crabb. Thank you. It is. Okay. Discussion. I'm not, was Mr. Watson's light on first? Go ahead, Mr. Watson.
Thank you, Madam Chair, and thank you to all the speakers that came out and shared with us tonight. First, I want to acknowledge that even with all the incredible energy this week with students coming back in full force, including, we know that there's at least one family in our community with a very heavy heart this week with the senseless death of their son, John. I can't imagine the pain that they're feeling. I don't want to detract from that tonight. My intention is not to also detract from the start of the new school year, but it's important given the meeting last week and the changing landscape as it relates to COVID. Again, thank you all to our public forum speakers that shared tonight and who have been sharing with us via email and many times in the past. You all know that I've stated many times throughout the last 9 months, this is not a conversation that I want to keep having. And I know that I brought it up this time, but I fundamentally brought it up because the understanding that I had in April evidently was not what the board approved, according to the law department. Over the last year, all of us have heard a wide range of concerns as it relates to the COVID-19 pandemic. We have heard from families who have lost loved ones due to COVID, folks who have experienced social and emotional trauma due to the impacts of the pandemic. Families have been upended economically. Many students have experienced an ever-widening gap in learning, and so much more. In fact, I would be shocked if not all of us in this room has experienced some loss to some degree due to the pandemic. Pandemics are extremely effective at that. They are destructive and they're painful. For the 2021 school year, KCS under Superintendent Thomas's leadership and the board consistently said we will follow the recommendations of our public health leaders, including CDC, the Tennessee Department of Health, and the Knox County Health Department. At no point during the last school year did any outside entity, not the governor, mayor, Tennessee Department of Health, CDC, president, et cetera, mandate that Knox County schools follow COVID protocols, including masks, with the exception of mask wearing on buses as mandated by the federal government at that time. Everything KCS did in response to COVID was due to Superintendent Thomas's and the board's leadership. We have made our own local decisions, and last year we consistently followed the recommendations of public health leaders, which was the appropriate thing to do. This allowed us to have those kids who opted for in-person instruction in school for 93% of the school days last year. Superintendent Thomas has stated that many times, and I completely agree. KCS has been able to accomplish something that many districts in our state were not able to do. Over the last 2 weeks, there have been a lot of talk about the impact of COVID on students and the impact it had on learning in particular. Everyone agrees that students should be in-person instruction as it provides the greatest opportunity for students to succeed. I also agree, but my concern is the more we become lax regarding COVID, especially now, the more we are going to see students out of school at best and at worst very sick and in the hospital. We also need to remember that students do not live in bubbles. Dr. Lisa Piercy, the head of the Tennessee Department of Health, said in Tennessee, children are about 10% of all cases right now, whereas it was only about 2% at this time last year. With all due respect to Mr. Dupler and our law department, although the votes in April and May had the effect of removing the superintendent's authority as described in the memo that was produced, I do not think that was the intent of the votes the board made in response to COVID in April and May. That they were to be taken singularly. The board was actively working to accomplish one thing, but it took 2 votes to do it. The board was working to entrust the ongoing COVID response back to the superintendent to become more nimble in response to the COVID pandemic as the situation has and continues to evolve. In order to do that, we had to sunset the policy regarding masks because the policy was not nimble. At that same time, which I also voted for that, at that same time, the board approved the superintendent's plan for the 2021-22 school year, which states KCS will follow the Tennessee Department of Health guidelines. During the April meeting, the board went to great lengths to ensure the wording of the plan matched the guidelines at the time, including language around masks. In the plan, there was also language to ensure that that KCS would pivot as the guidance changed. This put the ongoing response back into the hands of the superintendent with the guardrails of the Tennessee Department of Health. It was clear that the plan was to be implemented after the mask policy sunset, regardless of whether or not it sunset in August or the subsequent May date. It is also important to note that this vote occurred intentionally before the transfer window for the virtual schools, which was put in place May 3rd through the 14th. So families could make the decision based on what they were hearing from KCS for the 21-22 school year. I've heard from many families who have opted for in-person instruction over virtual this year because they believed we would be following the Tennessee Department of Health guidelines as outlined in the approved plan. Dr. Lisa Piercy also stated that the Tennessee Department of Health will not be issuing new guidance to schools. She stated districts should look to the CDC and the AAP, who has already issued guidance. We also know that Shelby County, Davidson, Hancock, Oak Ridge, and just today, Hamilton County and Henry County have continued layered COVID-19 protocols, including masks for this school year. And Dr. Childs, who's been a favorite around here, he's been mentioned in many meetings. I talked to him at great length last week, and then I know he was also on the news from East Tennessee Children's Hospital, said he also thinks we, speaking of Tennesseans in general, let our guard down, and students should opt to wear a mask in school. I've stated many times, I do not think we should make decisions regarding COVID-19 and KCS based on public opinion. That being said, I've continued to track public opinion through emails I've received on this matter. Each time I've tracked it, the strong majority is in favor of implementing COVID protocols in KCS that align with the CDC. That includes the 395 emails I've received over the past week, 68% of which said to follow the guidelines and 32% said not to, or to leave it up to parents. And I'm getting toward the end. Also, there are several petitions on change.org if you're interested in that. There's two current petitions. One, as of this morning, had 1,839 signatures asking for KCS to follow COVID protocols. And then there was another petition asking KCS to make mask optional, which had 1,114. And then there were two older petitions. There was one from April that had 155 signatures in the mask mandate. And give a little shout out to Raymond Jen over here. He took initiative, and he had a petition out in April last year in support of masks that garnered over 2,000 signatures at that time. He has since removed it because that was not the current issue, which I totally respect that he did that. Finally, since the board began discussing this issue in October of last year, I've consistently stated that I believe the board needs to choose whose guidance it is going to rely on regarding COVID-19 mitigation strategies and to empower the superintendent to do that. That is what I and the majority of the board voted for back in April. I know I voted this way because I knew the circumstances, and I believe others did, related to COVID would continue to fluctuate as it has. And the board didn't need to be discussing our response at every board meeting. With the sunset of the policy of C-240, which I voted for again, I have not thought that the right way to continue to navigate COVID in the coming weeks and months is through policy. I still believe we need to empower the superintendent and his team to adjust expectations, protocol, and requirements as the pandemic shifts. That being said, it seems that under the guidance from the law department that only the Board of Education can empower the superintendent to implement a layered response to COVID, including face coverings, which is why I offered the motion that I did tonight to authorize the Director of Schools to implement layered prevention strategies regarding COVID-19 that align with the guidance from the Center for Disease Control Prevention, including but not limited to contact tracing, quarantine, physical distancing, adding additional cleaning, and universal masking for all students, teachers, staff, and visitors while indoors. That guidance may change in several ways as the year progresses based on the community transmission rates for Knox County.
Thank you, Mr. Watson. Ms. Bounds.
Thank you. I was not going to share this tonight, but feel the need to. Matt's going to help me over there. Matt, if you can put up one of the first slide, please. I think it's been said, a picture is worth 1,000 words, or signatures, or emails, and we've had all of those probably this week. For those of you that can't read it, this says the CDC currently recommends that all people wear a mask indoors regardless of vaccine status. Matt, if you could show the next one, please. Okay. Some of you may not recognize this, but I'm sure Miss Horn and Miss Babb will, having had swimmers. This was 11 days ago at UT. This was the city swim meet. If you could put the next one up, Matt. Okay, and the next one. So there were 31 teams there, over 2,000 athletes plus families. Our family alone had 7 people in attendance in addition to the athletes. So just conservatively, if you said every child had one parent there, plus the 2,000 athletes, that would be 3,000 people. If you can change to the next slide, please. Tents were set up all around Stokely Athletic Center. Each team had at least 1, possibly 2 tents. And you can see in that picture that there's probably not 3 feet of spacing between those chairs. Next picture. There's just a sidewalk view of the tents that reached all the way around the building. And if you can add the next picture, there's another picture of the tents. Next picture. A picture of the spectators, the parents, the grandparents. And in all 3 days that I attended this event, I saw 3 masks. 3. Now, why is this important? Everyone could read the sign on the front when they went in that said the CDC currently recommends that all people wear a mask indoors regardless of vaccine status. Because I believe these people are representative of the people of Knox County that want freedom of choice. And is there one last one, Matt? Is that it? Okay. So I share that with you. Last year I shared a lot of examples of baseball fields, soccer fields. But as I sat there that day, 11 days out from starting school, actually just that was on the weekend. So Monday school started. And I looked at all these people and I thought, 3 masks. That's an interesting thing. And the thing is we can mask at the schools, but we can't mandate masks for the entire 24-hour day. And after school, this is what kids do. They aren't in masks. And the parents that want that freedom for their child to run on the soccer field and not have to breathe in and be able to breathe while they're running are choosing not to mask. So I would like to finish up because I had the privilege today of going to visit schools with Superintendent Thomas and visited 2 schools in my district. And I could count on my hand how many students were in math. Maybe 2 hands, no more. How many teachers and staff were in math? I could count on 1 hand, maybe 2. That was it. So people are choosing, and you, the board, the public, we cannot make people give up their freedom and mask. And it's not helping to, in my opinion, to mask kids in school if they're going to the ball fields and the swim meets and living life outside of school unmasked. So that's just my thought. And as I said, the board has received thousands probably of emails. That may be an over-exaggeration. And we've seen the surveys and the thousands of signatures, and we've had 1,000 words probably spoken over the course since April on masking. And yet, I think that all of this to say that people want their freedom, and we are not in the business. As an educator, it was my position that we need to educate our children. So it comes down to 2 things for me: freedom and education. And I'm not a health expert. I have read all the emails and all the studies on both sides that I can find. Thank you.
Thank you, Ms. Mounds. Ms. Christie?
And I'll keep my comments short as well. And I agree with Patty. I mean, and I look at those pictures and I guess what bothers me the most about that is I keep thinking about the Halls golf team. You know, that couldn't play last year. When really, if we knew then what we know now, they could have played. And a lot of things like that happened last year that I regret seeing happen. You know, and I think people on both sides agree, because we hear from both sides that they are in the schools and no one's wearing masks. Both sides have said that, and I think that speaks volumes to what the parents want. Parents want to choose, and I've had many parents tell me that their kids aren't going to wear a mask. So then it comes down to enforcement. How do you, are we going to expel 30,000 kids when they show up without a mask? I mean, I just don't know that this is going to work when Dr. Buchanan herself said she can't issue a mask mandate because she knows the community is not going to follow it. You know, and if the community doesn't follow it, what makes us think that parents are going to, you know, put the masks on their kids in school? So, and I don't have the answer to that, but I do think that, you know, the parents have made it clear that that's not something they're going to do moving forward. I would like to see some maybe clarity that concerns about people asking if students have been vaccinated, things like that. That bothers me, and I would like for us to address that as a district. And the other thing is, maybe, I know we have to report numbers to the state. I do think we need to at least give parents something so they can do their own risk assessments. You know, that they need to know if there's problems in their school, or that if there are a lot of cases. I mean, I would like to see us do some kind of reporting or go back to a dashboard of some kind so that parents could at least see what's going on in their schools. And I don't know if that's possible, but I do think we need to have something there to help parents, you know, to assess their risks. And, you know, some might want to wear masks some days and not on others, depending on what they're seeing there.
Thank you, Ms. Christie. Mr. Jen?
Thank you, Madam Chair. So I guess before I begin, I'd like to say two things. One, if I start stumbling over myself, my apologies. I don't have anything formally written down, so I'm just going off my head. Second thing is, I have a feeling that regardless of what I say, the decision that this board will make, and however much time we'll make that vote, is more or less set in stone, but I will still speak my mind. So as a student representative, I would, of course, first like to give the student thought on this issue. Yes, there are very few students who are wearing masks in school. Obviously, it depends from school to school. My school, Barrier High School, maybe 10%, maybe less, maybe a bit more. My little sister, she is in 6th grade. She goes to Barrier Middle School, maybe less than that. However, I also do know a lot of students who, although they may not be currently wearing a mask, they would gladly do so if a mandate were to be put in place. Additionally, I think, as with the public, the issue of mask mandates, no mask mandates, I do actually think that the student opinion might be split closer to half and half, and not as close to what we might see with the number of people actually wearing masks and not wearing masks. So that's kind of, I think that's kind of the student perspective. So either way, whatever the board decides today, you know, there'll be a chunk of students who agree, there'll be a chunk of students who do not agree, which the board did the other thing. So I guess kind of moving into my own opinions on this topic. Obviously, the Board of Education is concerned about the education of students in this county, and that is what we want to ensure. We want to ensure that our students receive the education they need to fulfill their full potential in life. Now, the issue with COVID-19 and masks is that, yes, I understand possibilities, especially younger students. If you put a mask on them, they may not be able to learn as well because they cannot see their teachers, enunciating their words. The teachers can't see them enunciating their words. Things like that might affect their learning. Perhaps mental health issues, stress, anxiety, things like that. I completely understand that. However, I'd also like to say that if students start getting sick, even if they do not die, even if they do not have to go to the ICU or be hospitalized. That is still taking away from the opportunity to learn. If a lot of students are getting sick, and we know that with this new Delta variant, COVID-19 transmission rates are higher. We have the case data these past few days, 80, 70, 60, 100. We see the data that came out today, hospitalization rates are going up. If more students are getting sick, even if they don't die or anything like that, I hope they don't, they will have a harder time learning because they will be missing school. So if we can implement safety precautions that ensure that our students can receive the education that they need, then I think that would be in the best interest of those students, even if they do not wish to wear masks, even if that is uncomfortable. As for mental health issues, I do sincerely hope that we have the resources necessary to help students through mental health issues. I was completely virtual last year. I know many virtual students last year, at least, did have many mental health issues. They had a very hard time learning online, and it was just a very difficult time. And to be frank, some of them didn't have the resources they needed. And I hope if this board does vote to issue a mask mandate, I understand that students will have some issues with that, stress, anxiety, whatever it may be. I do hope that we have the resources in place for them to feel comfortable, for them to feel that they can learn to their highest potential. And so I guess kind of closing, I sincerely hope that this board seriously, thinks about issuing a mask mandate for students to ensure that students can receive the education they need, even if it might be uncomfortable, even if I know a lot of people will talk about freedom of choice. Yes, obviously we have freedom, but the issue here is that your choice to mask your kid or not to mask your kid doesn't just affect your kid, it also affects other people's kids. And I think we can agree that we shouldn't have the ability to choose what happens to other people's kids, right? So, I just want to say again, I sincerely hope the board seriously considers issuing an mask mandate. Yeah, thank you.
Thank you. Mr. McMillan?
Thank you, Madam Chair. Just a brief comment. I was just sitting here thinking that I agree with Ms. Bounds and the Ms. Christie over here as to what they said. But I also thought, went through my mind that a couple of weeks we'll have high school football. And if you want to see people not masking and sitting close together in groups, I'm relatively sure that will happen. So, maybe it will. I don't know whether any benefit will come from it, or not, as far as like immunity. But I'm relatively sure that it's going to happen. Thank you.
Thank you, Mr. McMillan. Mr. Watson?
Thank you, Madam Chair. Thank you, Ms. Christie, for bringing up the point around data. Mr. Thomas, can you speak to what we learned from the Department of Education this week related to what we need to be reporting in terms of data with COVID?
As I understand, there will be reporting requirement for the district to the state. So I'm not seeing that template yet, but I know we're working on information to collect the data.
Do we know yet if that will be required to be reported at a district level or school level, or?
If it's like last year, I believe it's district level and not school level, but I'm not sure what what the requirement's going to be this year yet. So we should find out fairly soon.
So in order for us to report it at a district level, we'll probably have to receive it at a school level and then we'll roll it up?
We would.
Right. Okay. Thank you. And I believe the Department of Ed also said that would live on at least a state level dashboard where parents can see that. But I do appreciate Ms. Christie's comments, and I think there is some credence to making the decision maybe locally for parents to be able to access that at a school level. So they can see what's going on in their school and they can make decisions accordingly. Also, I want to point out that this motion is not a mask mandate. It's important to note that we have fairly limited tools in terms of COVID mitigation. One of the tools that we had last year that we no longer have because of the State Board of Education's rule was rescinded. Last year when we had kids that were either quarantined or we went on red or something like that, we can move kids to virtual learning. My understanding right now is that if kids do end up quarantining, that we can count that as a excused absence, and they will have access to potentially asynchronous materials online. But I think if we're concerned about learning loss, there are going to be kids who are out for long periods of time. And so what I'm trying to do in this motion is to not upend the ability for the director of schools, for Superintendent Thomas, to have access to all the strategies recommended for COVID mitigation. From my understanding from the law department's memo is that the superintendent still has the opportunity to implement every COVID protocol except for masking. And because the board rescinded policy C-240. So this is an attempt to give that authority back to the superintendent to be able to use at discretion based on what's happening in the community.
Thank you, Mr. Watson. Ms. Henderson?
Thank you, Madam Chair and Board. I'll keep my comments short as well. I just wanted to say that I completely agree with Ms. Bounds and Ms. Christie, and just wanted to stress, I also had the data part of Ms. Christie's comments written down as well. I think that it should be a personal choice in families, but I think that families do need that data to make the most informed decision. I think that freedom is best with full information. That way they can make this decision that best suits their needs. Thank you.
Thank you, Ms. Henderson. Ms. Babb?
And I was really trying not to say something, but I have a hard time. I'm really torn. Ms. McMillan's laughing at me. I'm really torn on this issue. I mean, this is not to me, a black and white issue. I've talked to a lot of people. I finally have just stopped replying to emails because I honestly just could not keep up. But it's still, I know what the messaging out is there, and I'm very torn about this. And I did propose another motion than Mr. Mr. Watson's tonight that I thought had a little bit more of a stop date to it, because where I'm hearing parents that I really have feel for is it is the elementary school parents that have not had the option to vaccinate their children. And I do think I don't know that every parent or even a lot of parents are going to get vaccinate their children, but I think for those that are really fearful and really care about this, that will sort of seem like a relief to them. So that is where I see some importance, and I do see a difference between what's going on in high schools and what's going on in the elementary school. And I know it even goes up to like 6th grade, depending on age of children. I'll be honest, I think the writing on the wall in our board is that this will not pass. But what is interesting to me is we have in our community places like UT and Pellissippi that are calling for mask mandates in the classroom. And I have a lot of friends sending their kids to UT, and a lot of them have very strong anti-masking feeling. Not one of them is not sending their kids to UT next year. I mean, they're doing what UT is telling them to do, and the leadership at UT has told them they want the masks in the classroom. And I think there are even some people here who have kids going, and I don't know that those kids are not going. So, I think that a lot of times people do follow the rules when they're out there, even if they don't want to. And so I just want to put that out there, that I just do kind of go with all of this with a heavy heart, because I do see both sides to it, and I really do hear what everyone's saying. And what I do want to appreciate is last week and this week, all of our public forum speakers on either side really spoke from the heart. And I do know that. I mean, I know each and every one of you is speaking because you think what you're wanting to do is the right thing for your children. And I really do appreciate y'all coming to speak. I mean, I know it takes a lot of time to come down here and sit through all this. Thank you.
Thank you, Ms. Babb. Ms. Owen?
Thank you, Madam Chair. I'd like to address several different things that have been brought up tonight, and so this may not be very, very organized. The first thing I want to think about is that people don't tend to make good choices. We don't make the choices that are in our best interests. And we often don't make the best choices in other people's interests. If we think about the choices that we make every day, we are not always making the healthiest choices. I'll also tell you that there's a s'mores donut at Krispy Kreme. Not a good choice, but it's really good. To the question of whether we have the authority, under 49.2203 in TCA, it says that one of our duties and powers is to manage and control all public schools established or that may be established under our jurisdiction. That's pretty straightforward. Governor Lee has said that we have the authority, so that authority shouldn't be something that we are still questioning when it is in law and when our governor has said that that is what we have, and unless someone wants to rescind that. The idea that PCR tests are not valid, that has come from a Canadian article that was misrepresented and misquoted the World Health Organization. So that is not accurate information that we're being given. Regarding studies, we were asked to supply studies that showed anything about masks being a valid mitigation. And one of those is from the Mayo Clinic. And this is in July. The Mayo Clinic has done a study on combined effects. So this is not just masking, but the combined effects of masking and distance on aerosol exposure potential. The conclusion is that the results support the principle of layered protection to mitigate transmission of SARS-CoV-2, the virus causing COVID-19, and other respiratory viruses, and emphasize the importance of controlling the spread of aerosol at its source. The source is our mouth. The combination of masking and distancing reduced the exposure to exhaled particulates more than any individual measure. Combined measures remain the most effective way to combat the spread of respiratory infection. And that is exactly what Mr. Watson's motion does. It gives the authority for combined measures. There's no one thing that we are going to do that's going to work 100% of the time. And I think we've all heard it described as a Swiss cheese kind of model. You have a piece of Swiss cheese, there are lots of holes in it, but you layer one on top of the other on top of the other, and eventually there are no more holes. And that's what these mitigation strategies are supposed to do. The more of them that we use, the better chance our kids have. Our responsibility as board members is not to only consider the healthy kids. We're required to ensure that all of our students have access to in-person learning. Not to do that increases disparities, which is directly against our strategic plan. We don't have to look to just the CDC. We have state and local health departments that make the exact same recommendations. We have the American Academy of Pediatrics representing 67,000 pediatricians and giving these same recommendations. To choose what public opinion may be over the recommendation of 67,000 pediatricians is irresponsible. And I realize that's not the singular opinion, but that's a representative group. To not ensure the safety of our students in our schools when we know that there is an issue that impacts the safety of children in our schools is criminally negligent. For conduct to constitute criminal negligence, the accused must know or should know that his or her conduct or the result of that conduct will imperil the life of another, given the circumstances that exist when the conduct takes place. We know that we are in a situation where instances of infection are rising. We know that they are significantly more for students right now. We know these things. We know that our students are at risk. We know that no students under age 12 can be vaccinated. We know these things, or we should know them. And for us to not consider those is extremely concerning. We have a student rep who has asked us very clearly to listen to him as the representative voice of our students. This is something that is important. We need to listen to that student voice. He is here for that purpose. When personal choice impacts me, that's my problem. But when my personal choice negatively impacts other people, it's no longer personal. That's something that is very much a problem that I have put on other people. We talk about data a lot, and we talk about all this data that we have, and I have some charts that show that community spread is right where it was at this time last year. We all know that. But if we go and look at these charts of childhood infection, they're not where we were in August. They're where we were in late November. But data that we don't have, data that I have asked for, and there's some conflict over whether we can have it, data we don't have involves data of our staff who have died. This board has not been told about staff who have died. And I think we need to seriously question why we are not given this information. It's important. It's important for us to know if we have staff who have died. It's also important for us to know data that we had last year that we do not have now. We need to know if we have staff right now who have COVID. And we don't have that information. We need this information to make good decisions.
Excuse me, can we have quiet in the audience so we can hear the speaker? Okay.
The bottom line, I think, is that this isn't really about masks. And it also doesn't change the vote that we took before. So whether we do this or not, our superintendent should still be following the guidelines of the CDC and our state health department. Thank you.
Thank you, Ms. Owen. Okay. Excuse me, thank you. Any other comments? Mr. Watson?
Yeah,
sorry, Mr.
Madam Chair, and Board, I'd like to ask a couple of questions. In reading Mr. Watson's motion here, just some clarification about align with. We've had a lot of conversation about recommend and require, and I think there's been some misunderstanding about what recommend means and what requires means. So I don't want to, if you approve this, I don't want to enter into this not really understanding the definition of align with. Can I substitute the word? I mean, I'm not making the motion, but just me personally, can I substitute that this mandates following the guidance from the Center for Disease and Control? I mean, that's the way I read it. Align with synonyms mean coincide, correspond, standardize, blend, combine, correlate, fuse, join, match, merge, pair, unite, equal, and match, so tell me exactly what that means. And if you approve it, then you're telling me that you're assigning me the sole authority to mandate masks and then enforce all disciplinary measures associated with folks who don't comply with that mandate. So if the board would just give me that, if you approve this, make sure that we all understand that's what this is saying. So I mean, Mr. Duper, you please weigh in too, if I'm saying something that's not exactly right.
Mr. Dupler?
Thank you, Madam Chair. No, I mean, I agree with what you're saying, Mr. Thomas. I mean, if the board's going to authorize you to pass down what the board has the power to do, which is to mandate a mask, then you need to know that. I think Mr. Watson said that it does not mandate, but I think you need to know one way or another.
Thank you.
I just don't want this to pass and me not understand, because it's already been made clear that I'm not following the board's vote from the last time you voted. So I don't want to not follow, pardon double negatives there, another vote that the board takes. So just be sure that I'm understanding that I have the sole authority to mandate masks in this school district. If this is approved, and then, as I said, to take disciplinary measures against those who don't comply.
Mr. Watson, would you like to respond to your light is on to your intention?
Sure. Yeah. Thank you, Mr. Thomas. I appreciate that question and that point of clarification. So from my understanding, since we've been entering into this conversation, not just for Knox County Schools, but globally around guidance of public health professionals, is it doesn't become mandated until the group with the authority mandates the recommendation. That's the way it worked last year, is all the guidance that we followed, it wasn't required until we required it. I don't think the CDC is the group that's going to make the requirement or not make the requirement. And so what I'm saying in this is that the expectation of the board, if approved, would be that you would work with your team and the Knox County Health Department, which I know Jason is still meeting with, Mr. Myers, and the Tennessee Department of Health, to make those decisions as things shift with COVID. And at some point, if you feel like, based upon community transmission, or which is what I state here, that it's time to mandate masks during that period, this would give you the authority to do that. If at some point, with the guidance of the Knox County Health Department and the Tennessee Department of Health and all those others that you get advice with, that it says we can lift that, then I would expect you would be able to do that. My intent in this is not to say, because Ms. Babb brought this up earlier, there's no time, there's no date end on this. My intent is not to say, at the moment this passes, Mr. Thomas is going to go mandate mask and it will never be lifted until the board votes on it again. That's not my intent. My intent is to give you the full authority to require masks, contact tracing, distancing, additional cleaning, whatever you see fit, based on public health officials' guidance. That's my intent.
Okay, so again, I guess I just want to be clear. If the health department recommends it and I don't mandate it and I don't do that, then what does that mean? Does that mean I'm going to be questioned by board members that want me to mandate it, and I'm going to be questioned by board members that don't want me to mandate?
You wouldn't be questioned by me, whether or not, I can't speak for every board member. My understanding from the law department's memo is that we somehow stripped authority from you related to masks when the policy sunset. And what I'm trying to do is say, we need to give you that authority back to be able to implement that as needed and as required.
And I'm fine with that. I'm not disagreeing with that. I just need to know when the health department or CDC or whoever recommends, is the expectation from you as a board that I adhere to that recommendation?
I can only speak, so my intent with this is not for the board to have to weigh into this with you all the time and tell you what you should or should not do. I mean, personally, as a board member, I think we should follow the recommendations of the CDC. That's what I've continued to say, and that's what I've continued to try to do. But I can't speak for the board as a whole about what their intent is. That is not my intent in this, to require you to do. The reality is right now, you could not do everything that the CDC recommends. There's recommendations that the CDC provides right now to schools that we technically could not do in Knox County schools. So to say we recommend, if we say we're going to recommend CDC guidance that we have to do everything, well, that's functionally not possible. Their whole intent as an organization is to have layered strategies that local communities decide on. And that's what I'm asking for here, is that we take that guidance of the CDC and we make local decisions, and that we empower you to do that as the manager of our schools, and not have the board weigh in on that every month. So.
Okay, thank you, Mr. Watson. Mr. McMillan?
Thank you, Madam Chair. Mr. Watson, since you mentioned it, I'm going to talk just a moment about the CDC, and I know other members, and I'm not picking on you, but you mentioned the CDC. I, for one, do not have any confidence in the CDC right now, because they keep changing things, and I'm just wondering if how many people really know much about what the CDC is right now, since this last lady took over. And I think it's a totally different organization than it has been in the past. And I don't think that is a good thing. I also don't think that, based on what we talked about last week, that, and what the law director told us, and what we talked about, that the superintendent has the authority to decide on masks or not. I think it's this board. And that's my opinion. That's why if we're going to vote on something, I'm not voting for it. I just wanted everybody to understand. Thank you.
Thank you, Mr. McMillan. Mr. Owen?
Thank you, Madam Chair. I'd like to try to answer part of Mr. Thomas's question. I believe that this and our previous motion were to allow the superintendent to change as needed. And the piece that I have had the most issue with is a piece that came out that said we would not do something all year. Well, that immediately took away the ability to change. That got rid of the ability, I mean, I guess you could have changed again, but when we put out a statement that says, no, we're not going to make any changes, when we don't know what might happen, that's where I found it problematic. Because we're trying to give you the ability to make those changes as needed. So we want it to be flexible. We want it to be something, I'm saying something that you can adjust as you need it. We have no idea what could happen tomorrow. And if we think about even as recently as when we took our TVA tower tours, we know that on Monday when you took a tour, you didn't need masks. On Wednesday when we took a tour, we did. Things change that quickly, and our board can't meet that quickly. So we need you to have the power to make those changes. And we need it to be flexible, and we need you to be empowered to do it without anyone saying, here's how it's going to be all year. I think that's where people have a problem, because when we say we're not doing this all year and then the situation changes, we have backed ourselves into a corner. And that is why I want to have language that allows you to work with everyone you need to work with, to make sure that we are making good choices for all of our students based on whatever information we have at the time. Thank you, Madam Chair.
Thank you, Ms. Owen. If I can just throw in real quick before we go to Ms. Bounds, if I'm not mistaken, back in April, the CDC was on that document and the board took it out, I believe. So I may be wrong about that, but I think it was on there initially, and then we asked that it be taken out before it was approved. So I'm wondering why the CDC is here instead of Tennessee Department of Health or some other organization. So, and then my other comment would be, I would be also a little concerned about this body asking the superintendent to make this kind of choice when we are the ones who have been elected. And this is I think that we're here to uphold the freedom and liberty of people. And so I do think people can make good choices. And I think right now people can make whichever choice they want to in our schools. So those are my comments. Ms. Bounds?
I'd like to call for the question.
All right. So we have a vote, we have a motion to call for the question.
Second.
We have a second. Is there discussion on calling for the question?
I would like to respond to your direct question, Tammy, if that's okay, before we call for the question.
We've already called for the question, so we're voting now on calling for the question. All in favor?
Aye.
Any opposed? Motion carries. Okay. Ms. Courtney, do you want to reread the motion, please?
Mr. Watson's motion is to authorize the Director of Schools to implement layered prevention strategies regarding COVID-19 that align with the guidance from the Center for Disease Control and Prevention, including but not limited to contact tracing, quarantine, physical distancing, additional cleaning, and universal masking for all students, teachers, staff, and visitors while indoors. This guidance may change in several ways as the year progresses based on community transmission rates for Knox County, and the motion was seconded by Ms. Owen.
Thank you. Ms. Courtney, can we do a roll call vote, please? Yeah, that's fine. Thank you.
Ms. Satterfield? Yes. Ms. Owen? Yes. Mr. Watson?
Yes.
Ms. Babb? Ms. Henderson? Ms. Bounds? Mr. McMillan? No. Ms. Christie? Ms. Horn?
No.
4 yes votes and 5 no votes.
Okay, motion fails. Thank you. Thank you. Please, we're not finished with our meeting, please. We have added board forum to our agenda. So, Mr. Jen, do you have anything for board forum?
I do also want to say, I know this is the first week coming back to school. I hope all students have had a good first 3 days, 2.5 really. And I hope that they continue to have a good, safe year. I hope that everyone can stay healthy and do their best to learn what they can, help with their future.
Thank you, Ms. Satterfield.
Thank you, Madam Chair. My sincere condolences to the family, friends, teachers, and everyone who loved and believed in John Keelian, John Mathis. There are no words to describe the somber feelings that cloud our community from gun violence. John impacted everyone he came in contact with, and had a smile that lit up the entire room. You see, in the community where I live, we're experiencing 2 pandemics, COVID-19 and gun violence. We have lost 6 children this year, 5 to senseless gun violence and 1 at the hands of the police. We need more advocacy from the community at large regarding the actual deaths of our children. For every COVID precaution and parent choice email, Facebook post, phone call that you make, I ask that you do the same for the lives of the kids that we have in fact lost. You can do both if you truly care. Take the same energy and pressure that you put on the Board of Education and take it to your county mayor, your county commission, your city mayor, and your city council, and ask that they seek experts in solving murders, hold people and systems accountable, and ultimately curb the pandemic curb the pandemic of gun violence. We are losing our kids, and this is everyone's responsibility. Justin Taylor, Janari Muhammad, Jamarian Gillette, Stanley Freeman Jr., Anthony Thompson Jr., John Keelian Mathis, you mattered and you deserve better.
Thank you, Ms. Satterfield. Anyone else? Mr. Watson?
Thank you, Madam Chair. I just wanted to thank you, Ms. Satterfield, for turning our attention to our young people in that way, because we have had people lose their lives. Thank you.
Thank you. Anyone on this side? Ms. Bab?
I'll just say, I'd like to echo, I'm so excited. We started school this year, and I've heard people are off to a great start, but I really do appreciate Ms. Satterfield's words, because I know we were all heartbroken Sunday morning when we heard about one more life right before we were starting school. And I think you speak for all of us in what we hope for. And, you know, that we hope that our community can come together over this really, really real issue that is killing our kids.
Yes, thank you, Ms. Bab. Ms. Henderson, Ms. Bounds?
Yes, several board members have already addressed this, but as an educator, I wanted to as well. Having taught in Knox County for 25 years in this system, where I was not allowed to be told if a student had HIV in my classroom because of HIPAA, I find it unacceptable that we have professional educators asking students to raise their hand if they have had the shot or not had the shot, and threatening or coercing them to get the shot if they want equal treatment as their peers who have had the shot. And just as unacceptable is an administration commending and praising students for wearing masks according to the CDC guidelines to keep others safe. And finally, I do not think teachers should be sharing with their students whether or not they've had the shot and why they chose to mask. So I'm just asking the superintendent and his staff to make sure at the next principals meeting that this is addressed all the way through the system with your supervisors, your principals, and on down, so that this does not continue to happen. So,
Thank you, Ms. Bounds. Anyone else? Okay, meeting is adjourned. Thank you.